I fight for justice.
I fight for equality.
I fight for those that remain unheard.
Amplifying their voices.
Fall upon deaf ears.
I fight for a revolutionized healthcare system.
One that is inclusive and mass-oriented. I fight to protect the health, rights, and welfare
of the people we are committed to serve.
Amidst the growing battle against repression.
This is what I fight for. What do you fight for?
My God, I hate drugs. And I had to kill people because I hate drugs.
To our police officers and other officials, do your job, and you will have the unwavering support of the Office of the President. They have to stop because the alternative are either jail or hell. Your concern is human rights. Mine is human lives. Ako magprangka ako sa inyo. Ako lang ang presidente na hanggang ngayon nagbubugbog talaga ng tao. Yan sa loob ng Malacanang.
Hinga. Pahinga. Kailan ba ako magpapahinga? Sino bang ultimong walang pahinga sa pag-alaga? Pag natapos ko to, makakatulong na ako. Ngunit, ito ba ang sistemang mamanahin namin? Mga bagong henerasyon ng mga doktor. Anong klaseng sistema ang bubungad sa ating paglabas ng paaralan? Sistemang pabaya. Sa mundo ng mga dapat may proteksyon sila. Ipinangako niya naman yun, di ba?
As a worker of government, I promise to do whatever it would take to give all Filipinos a comfortable life, fighting powerful interests and making...
Hanggang kailan ba tayo magpapahinga? Ngayon na ang oras para tayo mamulat at lumaban. Ang pananahimik sa panahon ng kawalan ng hustisya ay pagpanig sa mapang-api. Walang pakundangang pinagmumukhang kalaban ng Malacanang ang masa kaysa supuin ng pandemya. Pinatatahimik ang mga kritiko ng palasyo sa panahong dapat nakikinig sila sa hinaing ng mga nagugutom, nagkakasakit, nawala ng trabaho, at unti-unting pinapatay ng kakulangan ng aksyon ng gobyerno. Sa gitna ng pandemya, ang pagpapasara ng ABS-CBN, pagsampa ng kaso kay Maria Ressa, at pagtapak sa mga karapatan ng mga kabataan na magpahayag ng opinyon sa lipunan. Sa gitna ng pandemic at economic crisis, itinakas din nila ang pagpasa ng isang batas na maaaring magbalik sa atin sa madilim na parte ng kasaysayan.
Kaya kapwa ko med student.
Mula sa iba't ibang panig ng Pilipinas,
tayo ay makiisa, dumalo at magpadalo sa Solar 2020.
Ang boses ng estudyanteng medical ay dapat marinig.
Ang boses ng health sector ay dapat marinig.
Ang tinig ng nagkakaisang mamamayan ay dapat pakinggan.
Isulong ang karapatan ng mga health workers.
Isulong ang karapatan ng bawat Pilipino sa serbisyong pang.
Talsikin ang diktador sa Malacanang.
Good day, everyone. Please stand by as we admit everyone to the server for today's program. Paunang Lunas, a first aid training of PMSA, will begin in 10 minutes. Thank you. So ayun no, habang hinihintay pa natin yung lahat na makapasok sa server, quick reminders lang for the house rules. So una, we encourage everyone of course to turn on their cameras, pero okay lang din naman na hindi kung mahina yung bandwidth ng internet. And of course, please observe mute nyo yung sarili ninyo kapag may nagsasalita. And ayun, yun lang naman for now. So we'll start in a few minutes.
For justice.
I fight for equality.
I fight for those that remain unheard.
Amplifying their voices.
Fall upon deaf ears.
I fight for a revolutionized healthcare system.
One that is inclusive and mass-oriented. I fight to protect the health, rights, and welfare
Of the people we are committed to serve.
Amidst the growing battle against repression.
This is what I fight for. What do you fight for?
My God, I hate drugs. And I had to kill people because I hate drugs. To our police officers and other officials, do your job, and you will have the unwavering support of the Office of the President. They have to stop because the alternative are either jail or hell.
Your concern is human rights. Mine is human lives. Ako magprangka ako sa inyo. Ako lang ang presidente na hanggang ngayon nagbubugbog talaga ng tao. Yan sa loob ng Malacanang.
Hinga. Pahinga. Kailan ba ako magpapahinga? Sino bang ultimong walang pahinga sa pag-alaga? Pag natapos ko to, makakatulong na ako. Ngunit, ito ba ang sistemang mamanahin namin? Mga bagong henerasyon ng mga doktor. Anong klaseng sistema ang bubungad sa ating paglabas ng paaralan? Sistemang pabaya. Sa mundo ng mga dapat may proteksyon sila. Ipinangako niya naman yun, di ba?
As a worker of government, I promise to do whatever it would take to give all Filipinos a comfortable life, fighting powerful interests and making...
Hanggang kailan ba tayo magpapahinga? Ngayon na ang oras para tayo mamulat at lumaban. Ang pananahimik sa panahon ng kawalan ng hustisya ay pagpanig sa mapang api. Walang pakundangang pinagmumukhang kalaban ng Malacanang ang masa kaysa sugpuin ng pandemya. Pinatatahimik ang mga kritiko ng palasyo sa panahong dapat nakikinig sila sa hinaing ng mga nagugutom, nagkakasakit, nawala ng trabaho, at unti-unting pinapatay ng kakulangan ng aksyon ng gobyerno. Sa gitna ng pandemya, ang pagpapasara ng ABS-CBN, pagsampa ng kaso kay Maria Ressa, at pagtapak sa mga karapatan ng mga kabataan na magpahayag ng opinyon sa lipunan. Sa gitna ng pandemic at economic crisis, itinakas din nila ang pagpasa ng isang batas na maaaring magbalik sa atin sa madilim na parte ng kasaysayan.
Kaya kapwa ko med student,
Mula sa iba't ibang panig ng Pilipinas,
tayo ay makiisa, dumalo at magpadalo sa SONA 2020.
Ang boses ng estudyanteng medikal ay dapat marinig.
Ang boses ng health sector ay dapat marinig.
Ang tinig ng nagkakaisang mamamayan ay dapat pakinggan.
Isulong ang karapatan ng mga health workers.
Isulong ang karapatan ng bawat Pilipino sa serbisyong pangkalusugan.
At patalsikin ang diktador sa Malacanang.
Okay. Good day, everyone. In a few minutes, we will start the program. But before that, we would like to thank everyone for coming. And we would like to thank those people who made this event possible. Paunang Lunas First Aid Training of Philippine Medical Students Association in commemoration of the 48th anniversary of the Declaration of Martial Law is also brought to you by Philippine Medical Students Association PLM Chapter, Philippine Medical Students Association UERM. This event is in partnership with the following: ASMPH Student Council, BUCM's Medicine Student Council, DLSHSI College of Medicine Student Council, Manila Theological College-Lumos Medica Student Council, PLM College of Medicine Student Council, UERM Medicine Student Council, Southwestern University School of Medicine Medicine Student Council, BUCM Atlas Anatomy Teaching and Learning Academic Society, AMSA-UERM, UERM Med Kom, UERM The Aesculapian, College of Medicine, Brotherhood of Medical Scholars, PLM-CM Heralds, CBOL, CLCM Chorale, SLCM Ayatros, SLCM Musician Circle, Pangkalusugang Lingkod Bayan, and UERM Red Cross Youth Council. Also, everyone, we would like you to share the event, of course, to your Facebook feed. So you could share the YouTube link of the live stream in your Facebook feeds, and of course, don't forget to story the event with the hashtags Never Again, hashtag Never Forget, hashtag Health is Political, and hashtag Health is a Right. The Twitter and IG handle of PMSA is PMSA National, so you could tag the PMSA official account there. Thank you. Okay, everyone. Good afternoon. Welcome to the Philippine Medical Students Association Paunang Lunas, an online first aid training. sobrang hirap ng situation natin ngayon actually dahil bago yung sitwasyon, it's the new normal and may pandemic. But of course, it doesn't stop us from learning. It doesn't stop us from continuing to learn and continuing to fight for our rights. And we certainly did not expect that learning first aid in a virtual space. But of course, no, we're up for the challenge naman, di ba? Kaya tayo nandito. I hope that everyone is safe and comfortable at home right now. And sana stable internet connection ninyo kahit medyo mabagal yung internet sa Philippines, no? And sorry for kind of waiting, no? Pero we're still, of course, we want everyone to be here before we start the program. And again, this event is a partnership between PMSA, PLM, PMSA National, and PMSA UERM. So there's more potential to make new friends as well. And of course, diba, napakadami ng mga partner organizations, nakakatawa. Ang dami ng mga participants. Medyo nabulol pa nga ako sa pagsabi ng mga names. Pero ganun kadami yung gustong interested na matuto ng first aid. And ayun, no? Again, we're also inviting you to, if you're watching through YouTube, merong YouTube link yung ating Zoom conference. So, pwede kayong, if hindi kayo nakapunta sa Zoom, hindi kayo nakapag, ang tawag dito, nakapag-reserve a slot, you could share the YouTube link and comment, no? Comment sa your name doon sa YouTube link para mabigyan kayo ng certificates later on. Okay. Okay, so without further ado, I would like to call on Mr. Jed Marcueto, the President of PMSA National, for the opening remarks.
Hello guys. Magandang hapon, isang mapagpalayang araw sa ating lahat. So ngayong 2020, ginugunita natin yung 48th anniversary ng pagdeklara ng martial law back in the 70s. So bukod dito, ginugunita rin natin yung lahat ng karanasan na nangyari back in the 70s, lahat ng pag-torture sa mga kabataan, sa mga aktivista, at kahit sa health sector ay hindi rin tayo na kaligtas mula sa karahasan ng rehimen ni Marcos. At syempre, ginugunita natin ngayon yung masidhing paglaban ng mga Pilipino nung panahon ng martial law, kung paano sila nakalaya mula dun sa ganong ka-oppressive na katangian ng gobyerno. At syempre, ngayong 2020, kasabay ng 48 na anniversary ng martial law ay nakikita din natin yung malaking epekto ng pandemya sa ating bansa na nakaapekto hindi lamang sa mga mahihirap, kundi nakaapekto rin sa mga middle class kagaya natin. Kumbaga, itong pandemic ay na-challenge talaga lahat ng uri, lahat ng sectors ng society, pero ang pinaka-apektado pa rin ay ang mga mahihirap. And tayo bilang mga med students na alam natin na dapat na ang kalusugan ay political at ang kalusugan ay isang karapatan na nakakonekta kung anuman ang mga programa o ang hakbang ng gobyerno dun sa kaligtasan ng kalusugan ng mga Pilipino sa gitna ng pandemic. At nakikita natin na sa gitna ng pandemic ay ang sinagot ng gobyerno isang militaristic, imbes na health-centered na mga programs at intervention. At yun ay makikita natin na isang malaking sampal sa mga Pilipino at yun nga na pagtapak din siya sa karapatang pantao ng mga Pilipino dahil pinatupad ang anti-terrorism law kung saan tinatanggalan ng karapatan ng mga Pilipino sa malayang pamamahayag. Kumbaga, kung titingnan natin kung ano yung nangyari nung martial law nung 48 years ago ay nangyayari uli ngayon, kaya naman ang Philippine Medical Students Association ay nagkaroon ng initiative na gumawa ng event na relevant hindi lamang sa paggunita ng martial law kundi sa para na rin sa mapakita natin sa mga tao kung ano ang kasalukuyang kalagayan mga Pilipino ngayon. At sana makita natin na kung ano man yung nangyayari noon, ay nangyayari na rin ngayon siya, pero mas matindi siya at mas malaki. Therefore, mas malaki yung hamon sa mga medical students, sa mga kabataan na i-resist yung ganung uri ng fascism o ganung uri ng governance. Kaya naman, itong Paunang Lunas ay syempre, ito naman talaga isang first aid training event, pero more than that, dapat makita natin na sa society natin, tayong mga kabataan, hindi lang yung med students, ay merong responsibility na agapan yung mga kaganapan na maaaring mag-lead to mas worse na kalagayan sa lipunan natin. At syempre, ngayon, kahit hindi na tayo sa antas na maaagapan siya, pero dapat ay mapigil natin siya yung matinding karahasan na nangyayari sa Pilipinas. Ayun, sana marami tayong learnings, marami tayong matutunan ngayong araw. At laging tandaan natin na ang health ay ang kalusugan ay karapatan, health is a right, and health is political. At sana ipaglaban natin ito. Maraming salamat.
Ayan, thank you Jed Marcueto para sa isang napaka-warm na message, no. Talagang totoo 'yon, no, yung hashtag health is political, hashtag health is a right. No? Yun yung talagang core principle ng PMSA UERM, no. Yung PMSA UERM ay isang mass organization na nagtataguyod ng karapatan ng kalusugan, hindi lamang ng health sector but ng bawat mamamayan. Okay. So, I'm sure na lahat tayo excited matuto, excited mag-learn today. So, we will now introduce our first speaker. Okay. So, for our first speaker, he is the current Deputy Secretary General of Karapatan Alliance Philippines and is a certified acupuncturist. He is the spokesperson of the campaign to free the 43 health workers and was also the past national coordinator of Samahan ng ex-detainees laban sa detensyon at aresto. He led the delegation of human rights defenders in engaging in universal periodic review and was a lobbyist and resource person on human rights legislators such as the Anti-Torture Act, Anti-Enforced Disappearance Act, Human Rights Reparation and Recognition Act. So without further ado, everyone, let's give a warm welcome to Mr. Reneo Jigs Clamor.
Magandang hapon po sa ating lahat. Good afternoon to everybody. Una po sa lahat, sa ngalan ng karapatan, kami po ay nagpapaabot ng aming pasasalamat sa Philippine Medical Students Association for organizing this webinar, Paunang Lunas, and then ginugunita rin natin ang batas militar. Tulad nga ng binanggit kanina ni Jed, no? 48 years ago, nang naganap itong martial law, and yet yung remnants of martial law ay patuloy pa rin nating nararanasan. So, nais ko sa puntong ito ay i-share yung ating paksa na about the human rights situation in the Philippines. Ito po, no? Sana po at nakikita nyo sa screen. Okay, magandang hapon po sa ating lahat. 48 years ago, today, actually, September 19, 2 days from now, we will again commemorate the martial law 48 years ago. Pero sa mga tulad po, siguro majority of the participants right now, tulad po kanina, while bago po mag-umpisa to, ay hindi talaga hindi inabot itong martial law. Pero recently, a dean from San Beda Law said that ang kaya na lang po raw ng mga millennials ay construct yung nangyari nung martial law. Pero yung actual experience, of course, ng martial law ay isang bagay na usapin. Pero sa ngayon, 48 years ago, itong naranasan natin noon, nung batas militar, at i-share ko lang po na maikli. In 2013, a law has been passed reparating and recognizing the human rights violations that took place nung panahon po ng martial law. And then, nagkaroon ng reparation Pero yung batas na yun supposedly hindi lang siya simple sanang batas, no? Ang layunin sana ng batas na yon, yung mga human rights violations na nakomit noon ay hindi na ulit nating maranasan. But pakinggan po natin yung mga susunod na i-share. Ngayon, for purposes of leveling off po, nais ko lang i-share, no? Balikan natin. Even at the United Nations Office of the High Commissioner definition, ano ba itong human rights? Human rights are, sabi dito, human rights are inherent to all human beings, whatever yung kanilang nationality, place of residence, sex, national or ethnic origin, color, religion, language, or any other status. We are all equally entitled to our human rights without discrimination. These rights are all interrelated, interdependent, and indivisible. So, ayan, no? Yan yung definition ng human rights. Of course, historically, nais ko lang din i-share na itong human rights ay it's a product of the assertion of the people. Hindi ito basta na lang naging dokumento, kundi produkto ito ng pakikibakan ng mga mamamayan noon hanggang sa ngayon ay pinaglalaban pa rin. Ngayon, the Philippine government is actually a signatory to various international conventions and optional protocols. Ito po yun, no? Yung nasa screen, kung makikita po ninyo. Ilan lang yung babanggitin ko. Halimbawa, the International Covenant on Civil Political Rights, International Covenant on Economic, Social, and Cultural Rights, even the Convention Against Torture, at yung tinatawag ng 2006, itong second optional protocol on ICCPR, aiming to the abolition of the death penalty. Ngayon, pag pinag-uusapan ng human rights, it entails both rights and obligations. States assume obligations and duties under international law to respect, to protect, and to fulfill human rights. Tatlo po, no? Ulitin ko, no? To respect, to protect, and to fulfill human rights. Ngayon, when we say the obligation to respect, this means the state must refrain, no, from interfering with or curtailing itong human rights ng mga citizens niya. And then, when we say naman the obligation to protect, it requires the state to protect individuals and groups against human rights abuses. And ikatlo, the obligation to fulfill means the state must take positive action to facilitate the enjoyment of basic human rights. So, inuulit ko, tatlo: to respect, to protect, and to fulfill. Ngayon, tignan natin sa konteksto ng Pilipinas whether these obligations are really being implemented dito sa Philippines at ano yung ginagawa ngayon sa lukuyan ng ating gobyerno para ma-realize itong tinatawag nating human rights. But before that, I would like to ask our tech to panoorin po muna natin yung aming recently na ni-release na video about ano ba yung K natin, ano ba yung karapatan natin. Can we watch first this video that ni-release namin just very recently?
Tayong lahat ay may K. Tayong lahat ay may karapatan sa maunlad, mapayapa, at malayang pamumuhay. Tayong lahat ay may K. May karapatan sa malayang pag-iisip at paghahayag ng saloobin. Tayong lahat ay may karapatan laban sa pagdukot, iligal na aresto, torture, at gawa-gawang kaso. May karapatan ng mga magsasaka sa lupang sinasaka. May K ang mga manggagawa at mga empleyado sa maayos na kondisyon sa paggawa at nakabubuhay na sahod. May karapatan ang mga katutubo at Muslim sa kanilang identidad at lupang ninuno. May K tayong lahat sa kabuhayan, disenteng pabahay, libreng edukasyon, gamot at serbisyong medikal. Talagang may K ang mga kababaihan at LGBTQ laban sa pang-aabuso at diskriminasyon. May karapatan ang nakatatanda at may kapansanan sa makataong pagtrato. May karapatan tayong magsama-sama sa mga organisasyon, unyon, samahan o kilusan. May karapatan tayong kumilos at ipaglaban ang ating mga karapatan. Ipaglaban natin ang ating K. Ipaglaban at ipagtanggol natin ang karapatan ng mamamayan.
Okay, marami pong salamat. So, doon sa pinalabas nating video, na-educate tayo no, doon sa ano yung mga K natin, ano yung mga karapatan natin. So right now, gusto ko lang pong ituloy yung aking presentation. Ito po, no? Okay. Many of us may have heard that last year until now, the UN has been consistently monitoring the human rights situation in the Philippines. And in fact, in June 2020, the High Commissioner for Human Rights, Michelle Bachelet, reported to the Human Rights Council that extrajudicial killings and other human rights violations in the Philippines are widespread and systematic. So ito yung inabot no, na conclusion ng Office of the High Commissioner about the human rights situation in the Philippines. Actually, prior to this, ang naging basis ng kanilang conclusion doon sa submission na 793 written submissions and 793 individually template-based na mga complaints. So this means that based sa facts, no? However, just like what we have expected, the Philippine government, through its Department of Justice Secretary, denied the existence of impunity in the Philippines. He has also denied that there is a widespread and systematic violation of human rights in the Philippines. So, very reminiscent noong 2007 when former Special Rapporteur Philip Alston actually published his report about the human rights situation 13 years ago. No, ang sagot ng gobyerno, denial. So, right now, ganun pa rin. The Philippine government is in a state of denial. Ngayon, allow me to share some photo na nakuha ko po from the night crawlers, and one of them is actually Brother June Siriaco Santiago. Ito yung photo ng ilang mga war on drug victims na kino-cover nila. In fact, marami po sa kanila ay talagang umabot na sa point ng magkailangan ng debriefing kasi nga napakarami na mga na-cover nila na ganito yung mga itsura. Ito rin po yung isa, no? Photo na natagpuan, no? Ito malapit ito sa pier na kinover din po nila. So which right now the Philippine government through the PNP said from the period of July 1, 2016 hanggang August 31, 2020, meron po raw 7,884 people killed in anti-drug police operations. So sa totoo lang, itong figure na to ay mas maliit kumpara doon sa figure na ginawa ng research ng two credible media sources like the Rappler and Reuters. Sabi nila more than 27,000 yung victims of war on drugs ni Pangulong Duterte. And then of these thousands of victims, walang seryosong investigation na ginagawa ang Philippine National Police to really hold perpetrators of these killings accountable. No? Yan po. Now, allow me to share yung sinasabi naman naming mga killings of human rights defenders, killings involving yung mga activists in line with counterinsurgency program. Very recently, our colleague from Negros, Sara Alvarez, She was killed on August 17 in Bacolod City. Yan po yung actual photo nung makita siya. Ito po, nandiyan sa screen po ninyo. And then, just for the information of our viewers, participants, Sara Alvarez is actually a former political prisoner. Siya po ay merong anak din. And apart from being a human rights activist, guru siya, environmentalist, she works with different sectors. But instead of heeding kung ano yung pinaglalaban ni Sara, siya po ipinasla. The same goes with a known peasant advocate, Randa Lechanes. He was killed on August 10, 2020 in a rented house in Quezon City. When Dr. Fortune conducted the autopsy, she said that Randa Lechanes, hindi siya kagad pinaslang. There are torture marks na indicative na bago siya paslangin ay nakaranas muna siya ng torture. But who is Randa Lechanes? Randa Lechanes is, apart from anak pawis chairperson, siya po ay NDAPP's consultant. So there is an agreement between the Philippine government and the NDAP. Ang tawag po is Joint Agreement on Safety and Immunity Guarantees. At doon ang sinasabi, supposedly, whether there is a peace talks going on or wala, dapat patuloy silang kinikilala itong agreement na to. At yung mga katulad po ni Mr. Chanis, ay hindi hinuhuli, worse, pinapas lang. Now, apart from these killings, yung cases of enforced disappearances in the Philippines continue. One of the latest victims is actually Elena Tihamo, a program coordinator of the Farmers Development Center. She was abducted on June 13, 2020. 13 na po yung victims of enforced disappearance under the Duterte administration. And until now, we still have no information sa whereabouts ni Miss Tihamo. Ngayon, apart from this, the enforced disappearance, yung other forms of violations like demolitions, nagpapatuloy po yan. Based sa aming documentation in Karapatan, ito 6,492 victims of demolition. If you will recall, panahon ng yung pandemya, a group of 21 residents in San Roque, dito sa Quezon City, has actually protested because they haven't received enough assistance dahil nga may pandemya ngayon. But instead of heeding their calls, sila po ay inaresto. Sila ay mga urban poor na bahagi rin itong tinatawag nating mga homeless persons. Ngayon, apart from the demolition, yung tinatawag nating forcible evacuations in different parts of the country ay nagpapatuloy. We documented 456,103 victims from July 2016 hanggang 2020. And as we speak right now, as far as we know, based on the reports that we receive from our regional chapters, may mga kababayan pa rin tayo na napipilitang lumikas dahil may nagaganap na mga military operations sa kanilang mga lugar. Ayan, ito gusto ko lang din i-share itong photo na to na may mga victims din ng tinatawag naming forced and fake surrender na document kami from July 2016 to August 2020, 3,342. Itong photo na to, it was released by the Army's 9th Infantry Division. Pero it was exposed sa media na ito ay pinotoshop lang at parang itong mga mga surrenderies na to ay dati nang na-i-publish o na-ipakita sa publiko. So parang nire-recycle yung mga surrenderies, no? Okay. Kanina nabanggit na apart from these fake surrenderies, the criminalization of political offenses in the Philippines continue. At worst, yung mga political prisoners ay nauuwi sa wrongful conviction. And one of them is actually Gerardo de la Peña. Gerardo de la Peña is actually 81 years old na po siya to this year. He was wrongfully convicted at nasa New Bilibid Prison, a detention facility na mayroong 349% congestion rate. Ayan, the last time I went there, ang sabi sa akin ni Geraldo de la Peña, sabi niya, matanda na ako, sana sa huling bahagi ng buhay ko ay makapiling ko man lang yung aking mga mahal sa buhay. But until now, there is no reaction coming from the DOJ with regards to yung parole, pardon, at iba pang means para maka-release sana ang mga katulad ni Mr. De La Peña. But apart from Gerald De La Peña, ito, no, si Reyna May Nasino, she, together with two others, were arrested last year. Si Reyna May po ay buntis nung kamakailan at nanganak na siya sa jail, nanganak na siya, dinala siya sa Pabella. Day after ng delivery niya, binalik siya sa Manila City Jail female dorm. Ilang araw niya lang nakasama ang kanyang baby, and then the warden decided to separate yung baby niya sa kanya. So, actually, kami po sa Karapatan, together with kapatid and the Public Interest Law Center, has actually filed a petition in April this year. Ngayon, gusto ko lang din i-share. Ito yung photo, no, ng mga political prisoners in Sorsogon. Marami po silang nakakulong din doon. As you can see, no, sama-sama sila dito. One of them recently died, Rodrigo Lazar. He died of complications of diabetes last September 9. If only, for example, the Supreme Court or the Philippine government has actually addressed yung call ng humanitarian releases, sana po, no, na-release yung katulad ni Rodrigo Lazar. But, pare-pares po tayong na bigla, all of a sudden, President Duterte granted an absolute pardon to a U.S. Marine, ito po, no, si Pemberton. And very recently, nalaman natin that he already flown, no, back to the US. No? Mas inuna po itong sundalong Amerikano kaysa doon sa mga kababayan natin katulad ni De La Peña, katulad ni Reyna May, na ma-release on humanitarian grounds. No? Ngayon, ito po yung binanggit ko kanina. April 8, relatives to political prisoners filed a petition, but very recently we found out that the Supreme Court has only remanded its decision, its resolution to the existing regional trial courts para matinggin yung mga kasong hinaharap ng mga political prisoners. The very reason why, kapatid, itong 22 political prisoners filed is an urgent petition kasi nga there is now an extraordinary time that needs an extraordinary measure coming from the Supreme Court. In fact, maraming mga bansa na ang nag-release ng mga prisoners nila dahil sa pangamba na ma-infect nitong COVID-19, no? Pero sa Philippines, katulad nito, no, sa pangunguna ng 22 prisoners na to, may double standard, no, doon sa pagpapatupad ng releases. Until now, despite their being elderly, ailing, hindi pa rin sila pinakikinggan at nananatili sila sa mga kulungan. To summarize, there are 646 political prisoners all over the country. Congested detention facilities all over the country. 55 dyan ay elderly, 100-year-old women, 5 yung minors. And tignan niyo po, no? 413 out of 646 political prisoners in the Philippines were arrested under the Duterte administration. So statistically, it means 60% ng panahon ni Duterte. Mas maraming hinuhuli, kinukulong sa panahon niya. And then, ito yung summary naman ng violation of civil and political rights under the Duterte administration. Ayan po, no? 328 yung victims of extrajudicial killings in line with counterinsurgency program. 2,596 yung illegal arrest without detention. At alam naman po natin, no? In fact, during this pandemic, during this period, marami, no? Yung inaresto ng PNP for allegedly violating daw itong mga quarantine protocols, no? At yung ilang mga nagsagawa ng mga kilos protesta ay inaresto rin, sinampahan ng mga gawa-gawang kaso, tulad ng nangyari sa Iloilo, tulad ng nangyari kina former Representative Ayik Kasilaw when they did a relief operation in Central Luzon. So sinampahan din sila ng mga gawa-gawang kaso. So apart from this, yung filing of trump of charges, hindi lang yan sa mga activists, sa mga sympathizers na sinasabi ng government, pero yung media, yung attacks against press freedom ay naging evident, like what they did to Maria Ressa, the CEO of Rappler, who's been convicted for cyber libel. And the last time I checked, sa isang Twitter post niya, sabi niya that she is also facing a tax evasion. And then we all witnessed what they did to ABS-CBN, the allies of Duterte at the Congress, who voted against the franchise renewal of ABS-CBN. No? So malinaw. And this is the very reason why, for example, kanina, I was interviewed by a radio and sinasabi nga, no, the EU has actually cited case of Maria Ressa and said that the EU has also said that they will consider itong tinatawag nilang pagputol ng trade agreements with the Philippine government because of the rampant human rights violations in the country. No? Ngayon, apart from the attacks against the media, ito, no, in July this year, we all witnessed, despite the outrage, despite the opposition, President Duterte has signed the Anti-Terrorism Act of 2020. No? We know, in fact, kung di po ako nagkakamali, there is now 35th petition filed before the SC to question this Anti-Terrorism Act of 2020. Just a few days ago, gusto ko lang din pong i-share that meron nagkaroon na ng injury using this law. If I may recall, the first time that they implemented Human Security Act in 2007, katutubo po yung sinampahan ng kaso, si Edgar Candule. No? This time, katutubo ulit ang sinampahan ng Anti-Terrorism Act, si J. Tarung, sa Sitio Lumibaw sa Zambales. And apart from Anti-Terrorism Act, in violation po raw ng Anti-Terrorism Act, ay sinampahan pa siya ng ibang mga kaso. Si J. Tarong unfortunately, he was there when the encounter happened between the AFP and the so-called rebel groups. Pero ang nangyari, ang hinuli, itong si Mr. J. Tarong at siya pa yung sinampahan ng kaso ng ATA. Yun yung sinasabi ng marami sa atin, even the petitioners, na gagamitin talaga itong batas na to, no, doon sa mga karaniwang mamamayan kahit pa wala naman silang organizational affiliation. So ito na nga yung nangyari sa Zambales. Ngayon, President Duterte was not contented, no? In his latest SONA, he urged the Philippine Congress, both the House and the Senate, to pass a bill, no? Again, gustong ipanumbalik itong death penalty sa Philippines, no? Kanina binanggit ko po doon sa presentation that the Philippine government is actually a signatory doon sa second optional protocol, supposedly aiming for the abolition of death penalty. Kaya nga yung ilang mga the Commission on Human Rights has expressed concern na this move coming from the President at kung papahintulutan ng mga nasa Kongreso ngayon ay malinaw na magiging tinatawag po nating breach of international obligation. Ngayon, our President is really not really considering scientifically paano ba talaga dinideter yung crime, kasi marami na pong mga pag-aaral ang nagsasabi na itong death penalty is not really a deterrent to address yung crimes in various countries, no? Ewan lang mo sa atin sa Pilipinas. In fact, on October 10 there will be an event again, kasi maraming mga bansa na talagang gusto nilang maalis na itong death penalty kasi this is affront to human rights. Pero sa Pilipinas, gusto pang ibalik ni Pangulong Duterte. Ngayon, gusto ko lang i-share, no, bigyan tanaw itong 2021 budget. Tingnan po natin, yung priority of our government ay focus sa infrastructure, militarism, at yung the usual na pagbabayad utang kaysa sa pangkalusugan at iba pang mga serbisyong panlipunan. Tignan po ninyo itong infographics, no? Salamat sa Ibon. Dito, ang laki ng budget ng DND, 4.6%. No? That is actually 209.1 billion pesos. Kumpara natin sa budget ng Department of Health at ngayon na meron tayong kinakaharap na health crisis, ang budget lamang na ilalaan ay 2.9% or 131.7 billion. Kaya kanina, nung pakinggan ko po at nakita ko yung inyong video sa Philippine Medical Students Association, sabi natin, no, health is a right. Kailangan sama-sama tayong tumindig para ipaglaban yung batayang karapatan ng mamamayan sa kalusugan. Yan. Ngayon, I would like to add to Enos with two quotes at very recently na it caught my attention. Tingin ko, very relevant itong quote na to na iiwan ko po sa inyo na galing, no, sa isang K-drama. Ito yung sinabi. The one who neglects and turns a blind eye to the abuse is worse than the abuser. So, ang ibig lang mang sabihin nito, yung quote na to, tayo na narinig natin, we witness yung mga abuses na nangyayari sa ating bayan ngayon, sa lipunan natin ngayon. Sana po hindi tayo magbulog-balagan. Sana meron tayong gawin para hindi na maulit itong mga karahasan na ito. And then, lastly, I would like to share this quote from a martial law victim na tingin ko very timely pa rin at challenge, no, sa ating mga kabataan ngayon na gawin ito. Ito yung sinabi niya, no? Kung hindi tayo kikibo, sino ang kikibo? Kung hindi tayo kikilos, sino ang kikilos? Kung hindi ngayon, kailan pa? Muli, maraming salamat, no, sa maikling pagbabahagi ng kalagayan ng karapatang pantao sa ating bansa. At mamaya na lang po siguro if you have questions, I will respond to those na tatanong po ninyo. Marami pong salamat.
Ayan. Thank you, Mr. Clamor. Sobrang nakaka-inspire yung message, no, na ipagpatuloy natin na ipaglaban yung ating karapatan sa kalusugan dahil health is a human right. And sa usapin ng kalusugan, alam natin na included dito yung social rights natin, civil, political, religious liberties natin, no. As medical students, alam natin yan in the biopsychosocial model. Lahat ng factors talagang kino-consider natin para sa holistic health. Okay. So, if you have any questions for Mr. Clamor, please feel free to raise your hand. Use the raise hand function or button. And once acknowledged, you may unmute yourself to ask your questions. Kung medyo nahihiya kayo, pwede nyo namang i-type in lang yung questions. Babasahin namin. And ipapasagot natin kay Mr. Clamor. So, does anyone have a question? We encourage you to ask questions, syempre, no, para may malinaw, kung malinaw, kailangan ng clarification. Anyone? Anyone? May questions pa kayo? Now is the time to ask those questions. I think we're giving around 20 minutes for a question. So siguro mga 2 to 3 questions yon. Ayun, merong tanong si Doc Julie. Ano yung update sa ginagawa ng PCOO maligning members of progressive groups, especially with Lorraine Badoy and company?
Okay, so dun sa ano yung ginagawa ng PCOO, no? In fact, the PCOO, linawin ko lang din po, ang merong in December 2018, the National Task Force through an Executive Order number 70 was issued by President Duterte, institutionalizing ito yung tinatawag na whole of nation approach. At yung PCOO is actually part of that National Task Force to End Local Communist Armed Conflict. As far as we know, Lorraine Badoy did not stop doon sa maligning niya ng mga progressive members of progressive organizations. And the last time I've heard, halimbawa, yung ginawa po niyang pagmalay kay Mother Mary John Manansan, na sinasabing long-term ally po PPP NPA-NDF, si Mother Mary John Manansan. So, very recently, I attended also a hearing at the Congress. Lorraine Badoy also in her speech, in her statement, doon sa isang hearing, she accused Teddy Casino of being also a member or a personality of a CPP, and so, yun din, ibig sabihin, nagpapatuloy itong ginagawa ng PCOO. That's the very reason why in the recent budget deliberation, Bayan Muna Representative Caloy Sorate question the basis of the proposed budget ng NTF kasi lumalabas ang laki po ng budget nila na hinihingi kumpara doon sa budget na sana mapunta tulad sa binanggit ko kanina doon social services at sa health. Yun po, I mean, magpapatuloy yung ginagawa nilang maligning. And that's the reason itong mga killings and filing of trump-up charges ay nagpapatuloy din sa ating bansa.
Okay. We have another question from Roberta Burgos. Good afternoon. If or when the government does pass a death penalty law, may sanction po ba from the international covenant? Can they order to repeal a law?
Well, technically, malalagay tayo ang Philippine government sa bad light, Kasi again, inulit ko, kung ang Pilipinas ay signatory sa second optional protocol, ang expectation sa Philippine government is to adhere doon sa layunin ng second optional protocol, totally i-demolish na o i-abolish na yung death penalty sa bansa. As apart from that, nice ko lang din i-share na yung Pilipinas ay sumang-ayon din sa ilang mga mechanisms ng isa very recently ang tawag po doon yung Universal Periodic Review. Hinaasahan yung mga bansa na yung mga conventions na kanyang nilagdaan, yung kanyang nilatipika, ay sana patupad niya. Kaugnay dito sa death penalty, talagang sabi nga ulitin ko, this will amount to a breach of an agreement between the Philippines and the United Nations, in particular doon sa second optional protocol.
Okay. Our third question is from Jedmar Cueto, PMSC National President. Mas marami nang napatay yung Duterte admin than Marcos. Masasabi ba natin na mas masahol na ito kaysa sa martial law ni Marcos? Does this mean 1987 Consti can't protect us from having dictator?
Okay. Kung pagbabatayan natin yung figures, both, no, ng war on drugs, tulad ng binanggit ko kanina, based dun sa estimates ng mga media sources, sabi nila, more than 27,000. At meron din ng politically motivated killings, no, na 328. Masasabi natin na ano no, mas marami na yung pinaslang. To think that sa panahon ni Duterte, ilang taon pa lamang siya, no? Kumpara mo sa panahon ni Marcos noon na ilang dekada yon, no? Na from 1972 to 1986. Tapos, sa totoo lang, pag binalikan natin, no, lahat po tayo dito, maybe you all took the 1987 Consti as a subject. Sabi nga namin, no, as human rights advocates, ito ay mga meron tayong papel. Supposedly the 1987 Constitution, ito sana yung basis natin ng ating gobyerno na dapat sanang pinatutupad. Pero tulad nga nito, no, binanggit mo, kung matatandaan nyo, mababalitaan nyo, no, kamakailan nagsabi sila na they wanted, no, a revolutionary government. Nabalitaan nyo po ba yan? Ngayon ang sinasabi yung mga nagsusulong niyan na hindi raw sila hindi daw Duterte administration ang nasa likod, no? Pero I vividly recalled na when Major General Parlade was asked by Karen Davila, kung yung ibang grupo po bang mananawagan, hindi nyo ho ba huhulihin o arestuhin? Ang sagot ni Parlade, ibang huhulihin yon. Anong kaibahan nila dito sa nagsusulong ng ng sinasabing revolutionary government? So iba naman po daw yon. So kumbaga may double standard. So again, despite having this 1987 Constitution, hindi to hindi to guarantee na hindi tayo magkakaroon ng isang panibagong diktador. In fact, sa totoo lang kami, ang analysis nga namin, we are now under a de facto martial law. Yun din yung kaibahan ni Pangulong Duterte, no, kay Marcos. Si Marcos kasi openly he imposed martial law. But in the case of President Duterte, sabi niya recently, no, kung napakinggan nyo, he was able to dismantle the oligarchs without having to declare a martial law. Ewan ko kung napakinggan niyo yun at sa isang speech niya, in a tape speech sa Holo, in a gathering, sinabi niya yun. Pero, dagdag ko lang, his government has now more than 80 former military and police officials now heading the cabinet positions in the Philippines. Kung iisa-isahin natin, ng isang tyrant, present karamihan doon present si Pangulong Duterte. Tignan niyo yung similarities, no? ABS-CBN was then shut down. Panahon ni Duterte, shut down yung ABS-CBN. Yung ilang known media personalities, kinulong, kinasuhan, ngayon kinasuhan din. Yung mga killings noon ng mga known oppositions, rampant din. Yung mga political oppositions, like for example, what they did to Senator Laila de Lima, Senator Trillanes, nung panahon ng martial law, meron din ganyan. Present din yan. So, kung hindi tyrant ang tawag mo doon o diktador, I don't know kung ano pang itatawag po natin.
Okay. We have another question from BMS Royce. if and when na mag-impose ng sanctions ang EU, European Union, or any other country sa bansa, I think this is Philippines, magiging detrimental po ba ito sa growth ng bansa o di kaya access sa tulong mula sa ibang bansa?
Well, usapin ng politics and economics. Definitely there will be an impact, no? Kasi remember, the EU, the European Union has been supporting the Philippines. Example, tulad ng binanggit ko nga kanina na capacity building sa usapin ng mga halimbawa ng human rights. Pero apart from that, merong mga supposedly trade agreements, no, ang Philippines with the EU, at kapag natuloy yung sinasabi na pag-impose ng sanction ng EU, malaki, no? Halimbawa, para mas concrete, banggitin ko na lang. Ngayon, may mga existing mga European EU companies na nandito ngayon sa Philippines. Siguro para mas malapit, alam niyo yung H&M? Yung H&M is actually one of the EU corporations. So, syempre, yung mga corporations na yan, yung Holcim Cement, halimbawa, yung binubuong mga pag nagagawa ng mga bahay, at yung iba pa, lahat yan kapag nag-impose, halimbawa ang EU, yung mga existing mga corporations nila, at yung ilang mga trade with EU, ay magkakaroon ng tinasabi ko ng impact sa ating ekonomiya. Kasi ano yan no? Usapin ng pansinin natin na pag sinabi kasi nating growth, it refers to both GNP and GDP. So pag nawala yung pag nag-impose yung EU ng sanction na yan, mangyayari sa atin, syempre malaking yung porsyento na yan na supposedly magiging ganansya sana, no? Magiging bahagi sana ng sinasabi na GDP o GNP ay makakaapekto. Ngayon nga na may ongoing tayong sa EU, syempre mano pa kung tanggalin o mag-impose ang EU ng sanctions sa Philippines. So yun lamang po. Definitely there will be an impact doon sa growth natin economically sa bansa.
Okay. We have another question from Hazel Tanhente. Hello. What are the reasons why a lot of doctors to the Barrios are getting slain, especially in Mindanao? We have one from Iloilo who was killed a long time ago, Dr. Dre Perlas. His death hasn't found justice yet.
Okay, yun na nga, no? Yun din yung, as kami as part of the human rights community, that's the very reason why we are really pushing for every killing that nangyayari, that took place, there should be an immediate, impartial, and thorough investigation. In the case of Dr. Dre Perlas, as far as we know, halimbawa yung nangyari sa Iloilo, doon sa Mindanao, wala pa tayong nakukuhang information doon sa development ng case nila. Yun yung isang sad reality, no? Very reminiscent of what they did then to Dr. Bobby De La Paz nung panahon ng martial law. At yung iba pang mga doktor na pinasla ngayon. Kaya nga, sa bahagi natin, we think dahil meron tayong tinatawag na impunity sa bansa, itong mga perpetrators of killings, embolden sila na gawin ito kasi hindi naman napapanagot at wala namang nangyayaring mga seryosong mga investigation. So kaya siguro sa puntong ito, samahan nyo kami na i-add yung voice na dapat for every killing na nangyayari, immediately we share our piece, manawagan tayo ng justice. Lalo na sa hanay ng mga doktor.
Yun. Sobrang lapit ng issue kasi na yun, DTTB sa ating mga med students. Okay, so may questions pa ba? Are there any more questions? Or you can type them in the chat box. Okay, so mukhang wala naman na. last call siguro, last call of questions. Siguro one more question before we end this part of the program, the open forum. Any questions? I think no, wala naman ng questions. So thank you, Mr. Jigs Clamor, for answering those questions. And we really learned a lot of insights today about how health is really related with human rights. Ayan. So, okay pa ba kayo? Okay pa ba? Hindi pa naman drained? Kasi naka-first part na tayo nung ating training for today. So, mukhang overwhelmed na tayo lahat sa seriousness ng topics, info overload na ba masyado? So, baka magkaroon naman tayo ng fun moment ngayon dito sa ating program. So, ready ba kayo for an icebreaker, guys? Can I get a thumbs up kung ready kayo for an icebreaker? Yan. Gising pa ba kayo? Okay. So, yan. Meron namang mga nag-thumbs up. Thank you sa mga nag-thumbs up. So, now we go on to the icebreaker of the program. So, yung mechanics lang naman niya is I will read the questions and then meron mga choices. And then what happens is one of the members of the committee program, Shannon, will type go sa chat box, and then all of the attendees, we enjoin you to take part in the icebreaker. So type in the answer. The first one gathers 5 points. The second one to answer gathers 3 points, and the third one to answer gathers 1 point. So after the last question, the one with the highest cumulative points wins the game and gets a special recognition. Ayan. Okay. So are you guys ready? Kung ready kayo, can I get a thumbs up? Thumbs up. Ayan. Ready sila. Okay. So let's start the icebreaker. Okay. First question. Kailan pinirmahan ni Ferdinand Marcos ang proklamasyon ng nagdedeklara ng batas militar sa Pilipinas? A. September 9, 1972. B. September 20, 1972. And C. September 21, 1972. Ay, wait nyo muna mag-go. Si Shannon. Pero sige, trial pa lang naman to. Second question na lang ha. Wait for Shannon to type in go. And then Shannon you type your answer. So, okay, I think, Shannon, pakinote na lang yung unang tatlo na nagsagot. So, Ann Del Rosario, correct, letter C, gets 5 points. Irene Velasco gets 3 points. And Mark Joseph Aponesto gets 1 point. Was that noted? Noted naman? Okay. I feel noted naman. Let's move on to the second question. Okay. So again, wait for me to say the choices ha. And pagkabasa ko ng question din ng choices, then Shannon types go. Shannon Soriano types go. And then Shannon yung sasabihin or sasagutin yung answer sa chat. Okay. Number 2. Ilang taon nagtagal ang batas militar sa Pilipinas? Letter A, 10. Letter B, 12. Letter C, 14. Yan. Wow. Dami. Very good very good. Nagpa-participate. So okay, I will take note of the top 3 na pinakamabilis sumagot. Joseph Rem de la Cruz gets 5 points. Jehan de Campong gets 3 points. And Danalie Acosta gets 1 point. Okay, third question. Ano ang tawag sa plano na isiniwalat ng dating Senador Benigno Aquino III bago ipinatupad ang batas militar sa bansa? A. Oplan Virgo. B. Oplan Sagittarius. C. Oplan Gemini. Mga zodiac signs to Okay. Okay. Nag-go na. So, the top 3. May bilis sumagot Top 3 is, ano yung tamang sagot pala muna? Ayan, pa-reveal ng tamang choice. The correct answer is B. Oplan Sagittarius. So, Mark John Aponesto siya ulit. 5 points. Regine Marinelli Narag, 3 points. And Rolin Girly Relova. Sorry if di ko ma-pronounce ang tama yung mga pangalan nyo. Gets 1 point. Grabe, yung bibilis siguro ng internet ng mga mabilis mag-type in. Okay. So, next question. Ayan, okay, mag-move on naman tayo sa pop culture. What is the number one most watched movie or TV show on Netflix Philippines today? Ala, check nyo. Okay, letter A, The Devil All the Time. Letter B, The First Purge. Letter C, It's Okay Not to Be Okay. Yan, ako magkakaiba ng answers. Baka from yesterday yung isang sagot dito ah. Okay, so let's see what's the correct answer. The correct answer is A, The Devil All the Time. Yung daming time manood ng Netflix ha. Wait lang. Ako may mga nagkamali. Kala nila C, baka kahapon yung It's Okay Not to Be Okay. So, yung unang tamang sagot si Emmanuel Joshua Ubanya. Second, siya yung may 5 points ha. Si James Seda, yung may 3 points. And then si Roeth De Gracia, 1 point. Grabe, tricky question. Okay, number 5. Ulit, another pop culture question. What is, di ko ma-pronounce ng tama, di ako nanonood ng Umbrella Academy, sorry. Claus Haggerty's power in the Umbrella Academy. A, super strength. B, talk to the dead. C, time travel. Go. Ayan. Wow, ang daming nunood ng Netflix sa inyo ha. Daming time. Wait lang. Go. Okay. What is the correct answer? Correct answer is talk to the dead. Ang top 3 natin, si Carol, gets 5 points. Cristaline Lopez, 3 points. Dan T. Lee, 1 point. Okay. Ako mukhang iba-iba yung nakakasagot. Magandang labanan to. Okay, number 6. Okay. Okay, so pop culture pa rin naman. Ano ang pamagat ng pelikula na pinagbidahan ni Eddie Garcia kung saan tinorture ang mga kolehiyong mag-aaral? Sila, Tony Labrusca ata to, no? Millennial college students na isang retiradong kolonel na nagsilbi noong panahon ng diktadurya ni Marcos. Ayan. Wow, ang dami. Wait lang. Wait. Ayun, okay. So, the top 3, ang correct answer pala muna is letter B, ML, no? Letter B, ML. So, the top 3, 5 points si Jendra Dolatre, 3 points si Eugenio Ares. Wait lang ha. Tapos si Jehan de Campong gets 1 point. Okay. Next question. Okay. Ano ang pinakahuling balita tungkol kay yung favorite nating si Cynthia Villar? Ayan. Letter A, actually, di kailangan ng nurse magtapos ng BSN. Letter B, we don't need land. We don't need water for agriculture. C, gawin natin itong subdivision. Ayan. Wow, ang dami. Ang bibilis sumagot. Okay. Grabe, so dami. B. Okay, what's the correct answer? Correct answer is letter B. We don't need land. We don't need water, no, for agriculture. Grabe nyo, ang lakas ng apog yung sabihin yan, no? After converting lands. Okay, so the top 3 is BMS George Celeridad, 5 points siya. Si Rowelyn Gerlida Love, ito, nakasagot siya ulit, 3 points. And si Mark Joseph Aponesto, no, gets 1 point. Okay. Yung mga familiar names. Number 8 na tayo. Number 8. Number 8. May number 8 pa ba? Or yun na yun? Wala na. Last na pala yun. So, yung nagtatali pala yun, yung mga nagtatali sa programs. Ayun, wala na. Last na yun. Okay. So, okay. Sino yung top 3? Patali naman. And then para ma-recognize natin yung mga top 3, no, dito sa icebreaker na to. Did you guys have fun? Okay ba? Okay ba yung mga tanong? Hindi lang siya puro tungkol sa topic natin. May mga pop culture questions din. More pa daw. Nag-enjoy sila. Ayan. Sino na yung top 3? Ayan, bago tayo mag-move on sa ating second speaker. Ayan, top 3. Pero may mga anong tawag doon? May mga common names. Sila yung nagiging top 3 palagi eh. Program team. Ayan. Sige, so habang tinatali pa nila yung scores, we would like to enjoy nyo na i-share nyo yung YouTube link nung ating Zoom conference sa inyong Facebook pages and share nyo yung stories, ganyan, videohan nyo or picturean nyo yung ating discussion. Use the hashtag health is a right, hashtag health is political, hashtag never again, and hashtag never forget. Okay, so habang tinatali pa, ayan. So habang busy pa, tinatali pa ng program, yung ating top 3, pasalamatan ulit natin yung ating mga sponsors. De joke lang. Yung ating mga partners. So, of course, PMSA National for spearheading the event together with Philippine Medical Students Association, PLM, Philippine Medical Students Association, UERM. This event is in partnership with the following. Ito na naman. Okay, mahaba. ASMPH Student Council, BUCM Medicine Student Council, DLSHSI College of Medicine Student Council, Manila Theological College-Lumos Medica Student Council, PLM College of Medicine Student Council, UERM Medicine Student Council, Southwestern University School of Medicine Medicine Student Council, BUCM Atlas Anatomy Teaching and Learning Academic Society, AMSA-UERM. Let's go AMSA. Ayan. UERM Med Kom, UERM The Aesculapian College of Medicine, Brotherhood of Medical Scholars, PLMCM Heralds, CBOL, SLCM Choral, SLCM Ayatros, SLCM Musician Circle, Pangkalusugan Lingkod Bayan, and UERM Red Cross Youth Council. Okay, so again, don't forget to use your hashtags for your posts or stories. Hashtag never again, hashtag never forget, hashtag health is political, hashtag health is a right. Follow us on our official handles, Twitter and IG at PMSA National, and on our Facebook page, Philippine Medical Students Association. Yung logo natin sa PMSA, yung yung may triangle and then yung may stethoscope. Ayan. Tama. Yun yung mga hashtags. Chinat na rin ni Sandy dito sa chat box. Program, tapos na ba? Yung ating pagtatali. Program, calling the attention of program. Pa-chat na lang. Pa-chat na lang dito sa Zoom group chat. Okay, grabe talaga. Thank you guys for making time, grabe, as med students, ang hirap mag-squeeze in ng time for extracurricular activities. But of course, di dapat natin kalimutan yung ating other capabilities, sa mga organizations, ganyan. Okay, so and ini-invite pala kayo ng PMSA para sa mobilization sa September 21. So yun nga, first aid training din to. So might as well ma-apply nyo na rin yung skills na natutunan nyo doon sa mobilization. So yung conduct ng mobilization, September 21, 2 p.m. ang assembly at Burles Rest Elliptical, tapat ng LCP. So yun, punta kayo doon September 21 kung pwede, lalo na sa mga within Metro Manila area. Okay, program, okay na ba? Program. Natali na ba yung top 3? Okay, I think tinatali pa nila. Baka dikit yung labanan na baka may nagtay ha. Ayan, okay. Tinatali pa lang. Okay, sige. Stretch natin. So, kamusta naman so far yung yung talk? Ayan. Okay naman ba? Hirap hirap pag online classes, sobrang hirap talaga Like ang hirap makakuha ng response. Syempre, ang daming factors pag online classes, na-disconnect ka, 'di ba? Ano pa ba? Disconnect ka, nawalan ka ng internet, deadbat yung laptop mo. Ang daming extraneous factors. Ayan, yung mga UERM dito. Sino mga UERM dito? Pa-thumbs up naman. Kamusta yung exam natin this week? Okay ba? Nakasurvive ba tayo? Grabe. Grabe yan, yung mga UERM. Solid, yan. So, di pala ako napapakilala. Ako pala si Clark. Ayan, ang address head ng PMSA UERM. So, ayun. Grabe, kakastapos lang nung exam week namin. Grabe, nakakatuwa, na may ganito na ulit akong time. Ayan, para tayong time, di ba, para i-push yung ating mga extracurriculars. Ayan. Okay. Ayan. Grabe, Okay. Habang tinatali pa, stretch pa natin. Ayan. Gusto ko na kami mag-host ng mga talaga face-to-face events. Stretch pa natin. Ayan. Yung PLM, kamusta naman kayo? Ayan, kumusta naman yung mga PLM? Di ba, kaka-start pa lang ata. Mas maaga ata ang UERM, no? Okay. Ayan. Saks lang daw, saks lang. Yung ibang mga schools, di ba, hindi lang UERM and PLM ang nandito? Okay. So, sige. Habang tinatali pa yung scores, at a later time na lang natin i-announce yung top 3. Para ma-recognize kayo. Okay, alright. Okay, so we move on na lang, no? Move on na lang tayo sa next part ng program. Ayan. Okay, so for the next part, thank you for the active participation nga pala sa ating icebreaker. At bago pala yun, wait lang, may pinapa-announce ang ating president. Okay, kapag pupunta sa mobilization September 21, please message the pages or any officers ng PMSA PLM, PMSA National, and PMSA UERM. If taga UERM and PLM, kapag PLM and UERM, yung PMSA PLM UERM yung i-message nyo. Kapag taga UPCM, yung Pangkalusugang Lingkod Bayan, and for other medical schools, PMSA National. Yeah. So sana maraming makapunta sa mobilization at makapag-serve tayo ng ating kapwa-kababayan through first aid. Solid. Okay. So without further ado, sige, i-introduce na natin ang ating next speaker. Sobrang fun, no, nung icebreaker natin. So okay, now let's move on to our next speaker. Okay. So our next speaker is a consultant of the Field Assistance Unit of Council for Health Development and convener of Coalition for People's Rights to Health. She is a spokesperson of Citizens Urgent Response to End COVID-19 or Cure COVID-19 and the Secretary General of Community Medicine Practitioners and Advocates Association or COMPAS. She graduated as magna cum laude of a degree in BS Zoology from UP Diliman and a graduate of UP College of Medicine Batch 1995. She was a past program director for community-based health program in Bukidnon and a consultant for various CBHP programs in Western Mindanao and North Central Mindanao. Lastly, she also served as an executive director of Community Medicine Development Foundation Incorporated. So for the main event of our program, everyone, let us give another warm welcome, this time for Dr. Julie P. Cagyat.
Hello! Good afternoon sa lahat, no? So ito na naman tayong session for our first aid training and siguro ang dami nyo ngayon, ano, 100 plus or almost 200 tayo ngayon dito. I know very difficult. It's very difficult to give a first aid training sa online kasi syempre more of ang style talaga namin ng pagbibigay ng first aid training is practicum, no? Return demo. But just the same, alam ko siguro sa inyo amongst you, ilan na sa inyo, marami-rami na rin siguro nag first aid training. So it's just a review for you. Tapos yung sa iba na baguhan, well, very basic lang naman yung mga principles na ituturo. And I think some of them will be an assignment na lang na makikita nyo naman online, especially dun sa demonstrations. So, I would like to start off with 10 questions. So, kanina, question and answer rin pala yung kanina yung breaker, no? Pero for now, bago tayo magsimula dun sa lecture or dun sa discussion, I'll share on screen 10 questions. Yung answers, you keep it to yourself and then we'll recheck it later also. Kasi parang pre-test to, no? Tas mamaya, after nung discussion, check ulit tayo nung check ulit tayo dun sa mga tanong kung mapa-perfect nyo na. Or baka ma-perfect nyo na ngayon itong 10 tanong. So, well and good. Okay? So, I'll just share for a while. Ito. Okay. Sige. Nakita nyo ba? Clark?
Yes po. Yes po.
Makikita. Sige. Can I start? Sige. Yung questions, hindi nyo na kailangan isagot dyan sa chat. It's to yourself. You write it down or mamaya, tingnan nyo na lang kung tamang sagot natin at the end. So, it's just a way of assessing yourself, no? Sige, 10 questions. Very madali. Sige. Let's start. I'll give, sige, yan. Number 1. Before responding to first aid scenario, what is the first question you should ask at the scene? Una, letter A, age of the injured person. B, nature of the injury. C, safety of the scene. D, time of the injury. So, ano dyan yung sagot nyo? You don't answer sa chat. You keep it to yourself. Then we'll check later. Okay? Clark, ano mo na lang ako kung masyado mabilis, ah. I'll go to the second question. You are first at the scene where you saw that the victim is unresponsive and has just thrown up o nagsuka. You're not comfortable giving CPR. What will you do? So letter A, wipe off the face or cover with the shirt. Letter B, compression only CPR. You do that. Letter C, go get help. Or letter D, do not initiate resuscitation. So yan yung second question. Okay, next. How often should you recheck for a pulse when you are performing rescue breaths on an unconscious patient with a pulse? A, every 45 seconds. B, every 1 minute. C, every 2 minutes. And D, every 4 minutes. And number 4, when should an unconscious patient be placed in the recovery position? A, if the patient has bradycardia and is not breathing. B, if the patient has a pulse and is breathing appropriately. C, if the patient has no pulse and is not breathing. D, if the patient has a bounding pulse and is not breathing. Okay, that's 4th question. Oh, yung panglima, ito. What are the basic life support steps used for adults? Ano yung sunod-sunod? A, assess the individual, give 2 rescue breaths, defibrillate, and start CPR. B, assess the individual, activate EMS and get AED, check pulse, and start CPR. C, check the pulse, give rescue breaths, assess the individual, and defibrillate. And D, assess the individual, start CPR, give 2 rescue breaths, and defibrillate. Medyo tagalan ko ng konti dito. Okay. 6th question. The recognition of shock includes, ano dyan yung very for shock? Slow deep breath. B, slow strong pulse. C, pale clammy skin. D, flushed dry skin. Maning-maning na to sa inyo. Okay. Wait lang. Ayaw mag-move. Ayan. Number 7. In prioritizing casualties, which order do you follow? In casualties to assessing. A, breathing, bones, burns, bleeding, others. B, bleeding, breathing, bones, burns, others. C, breathing, bleeding, bones, burns, others. D, bones, burns, breathing, bleeding, others. Okay? Number 8. In the treatment of acute soft injury, the acronym RISE stands for, wag mag-google wag mag-google. Raise, immobilize, comfort, evacuate. B, rise, rest, ice, compression, comfortable, elevate. C, raise, ice, compression, comfortable, position, evaluate. Tapos D, rest, immobilize, comfort, elevate. Okay? Number 9. Ay, mag-move. Signs of heat exhaustion except, ano yung mga signs of heat exhaustion except? A, contracted pupils. B, reddish or pale skin and moist. C, thirsty. D, sweating. Ano dyan yung hindi? And then last, what degree of burn destroys the epidermis and dermis? They may go into the innermost layer of skin, the subcutaneous tissue. The burn site may look white or blackened and charred. 1st degree, 2nd degree, 3rd degree, or 4th degree. Okay? So, balikan natin yan mamaya after the discussion. And stop ko na yung sharing. And then let's go na to the discussion proper. So, I'll share now yung slides ko po is in Tagalog Sorry, pero okay na yan.
Ay, ma'am, may concern po.
Ay, ano?
Kasi, anong tawag doon? Yung iba po kasi hindi nakaka-intindi ng Tagalog. So, kung kaya daw po na ma-translate in English or kung mas
sure.
better daw po kung English. Thank you po.
Sige, sure. No problem. Okay. Parang halo naman eh. Okay, sige. Before I start the discussion proper, kasi di ba we discussed human rights situation with with Jigs Lamar. It seems that for our situation now, it becomes necessary to air yung practice talaga our right to free speech and the right to associate, especially during this time that our human rights are being severely violated. So it is a call also as an invitation of PMSA to join the September 21 rally commemorating the 49th or anniversary or the celebration of the declaration, not really celebrating, but denouncing the declaration of martial law and the attempt to revise history. So on for a while. So it is always we have to, of course, for a while naglolo ko yun. Ayan. So we must ensure because social distancing is still hindi pa yan really allowed although in minimal because we are in GCQ, they are allowed at certain number of people like in churches, in celebrations. So pero we have to take precautions always. And for the reminders, we will always, like the organization, PMSA will always decide on how to invite people to these activities. They have to weigh into the degree of how the disease is still spreading in specific locations where the activities will be held. Pero once they decide to hold the activity, it is always imperative to ensure that those who will attend will be med students naman kayo, so you are within the 21 to 59 years of age, but you will also have the responsibility to advise other people who are interested, if they are not med students, or if you know people if they are sick or if they have a high risk comorbidities, then do not attend anymore. Okay. Or if they are currently sick, in order to protect not only themselves but also the others. You have to wear masks. So yung wearing mask, and then if you like the face shields, better, and ensure that you will bring the necessary alcohol, to clean your hands with, and then ensure physical distancing. And then the organization will ensure that there are safety officers or marshals who will ensure the physical distancing and all the precautions are being observed. So the individuals for the transportation, of course, you have to ensure safety also, whether you're going by public transport or if you have individual transportation, which is better, like bicycle, or kung mag-walk lang kayo or maglalakad. So that is better. And then, you say, of course, when you go home, you will still have to observe safety precautions and not bring in the virus inside the house. So you have to change clothes. Yeah, you bring change of clothes, and then it's better to take a bath. And then yung safety officers would ensure na the attendance is being kept in case you need for contact tracing, kunyari. Kung if ever there is a case of a spread of or maybe positive that you come up or you connect with. So yan po yung bakit we have the right to to join rallies, but at the same time to err on the side of precaution. Okay? So yan yung una natin. And then we go to the lecture proper. So I think if you will define first aid, it's a systematic series or it's a systematic application of health or needed support for people who have suffered trauma or any form of disease that needs to be taken care of. So ang sinasabi natin The purpose really of first aid is one, of course, to save the life of a patient. No? If they have an injury, or if they are wounded, or if they are in danger. And next is also to prevent further damage or further injury to the patient, and also to prevent complicating the injury or whatever problem the patient has endured. Another purpose of first aid is to, if there is pain, to lessen the pain and to make the patient comfortable. So that these are the very important objectives of why we will extend first aid to different kinds of people. And what are the basic, what are the basic tenets of extending first aid? First is, you do not give first aid if you are not sure of what you will be doing, because we will always err on the side of safety. It would not really help if you do not know what you will be doing and then you will extend help. Just make sure that you will be knowledgeable enough and comfortable enough to extend the first aid if it is needed so. And then, of course, it's very important that you have the patience to talk to the patient, or if the patient is unconscious, to be able to assess the patient. And then, of course, you should be calm and not, if you, baka kasi kayo pa yung maging unang pasyente if you are not calm and you are, you panic in front of such a situation. And then, you do not move the patient without proper assessment, and you have to be methodological as to how to assess a particular patient who is injured. And then you have to have the assessment, very well assessment, and prioritize who to serve first. And those we will prioritize are those who are most injured, and then before going to the less injured ones. If the patient is unconscious, you do not force them to wake up, and then do not force them to drink anything, any fluid to wake them up, and then be meticulous. So it doesn't mean that you have to look at all sides of the body, the front, the back, the sides, from top to bottom, and but make sure that your safety always comes first. So, for example, there's an explosion or a fire, no, and then the patient is there near the fire, unconscious. Please make sure that you will transfer the patient to a safe place, because you and both the patient will be in danger if you do not do that. So safety first, no? Safety first of the first aider and the patient that you will take care of. So yan yung mga basic tenets for giving first aid. And then, of course, as a first aider, no, you should be willing enough, no, to extend help. And you should be calm. You should be patient. You should be good in decision making, and be observant also. And you should have the basic skills on first aid. So aside from what we are discussing now, you could read on. So there are a lot of materials you can look up to and then read on. But of course, it's also in the practice and how you will do that. So if most of you are still not into clinical practice, I think that would be part of the skills that you can gain when you go look at patients, and then when you join other activities. And if ever you will go to the rallies and then be able to extend first aid, then that would be the most the standard for gaining the skills, no, for first aid. So what are the basic steps for extending first aid, no? When you are at the site, for example, you only have one patient at hand, no, the first thing you will look at is if there are other people, then you can ask them what happened, the nature of the injury, And then the conditions, is the patient safe? And then if the patient is conscious, then of course the patient may be in shock or parang nininervyos pa yan o bothered or hindi talaga makakoncentrate, then the first thing you should do is try to calm them, no? So if you do not know the name, then you can ask. If they cannot give their names, then you just call them in general, and then ensure them that you are there to help them. But if they are unconscious, then you try to wake them up. So how do you try to wake up a patient na unconscious? Of course, if you are considering an injury with the head and the neck, then be careful, no? But at the same time, how do you ensure that they are breathing and ensure na may heartbeat and ensure that they can be kaya silang gisingin, or you can wake them up. So for one, what is the best way to, one is to call them, no, or tap them on the shoulders, no? If you know the name, then they could shout their name. So Julie o Agnes, o yan, so ganon. So pag ganon, if they are responding or if they are not responding, then you can put light pressure on a bony part of the body. And the best place that we do that is on the forehead, dito sa middle ng eyes, or on the chest, dito sa chest, okay? Sa chest part, sa sternum. And you do that using your folded na hand. And use also the bony part of your hands to put pressure, okay? Kasi that will try to elicit pain and I try to wake them up. Pero also on the sternum, you can do also. So yun yung how you can stimulate them to wake them up, or if they are medyo semi-conscious. And then the breathing and the heart rate, the heartbeat. So sa breathing, what's the best way to the breathing? Well, if you can see the chest rising and falling, so that's, you can assume na, nagbe-breathe talaga siya. And then, pag hindi, pag very slow or parang hindi masyado, you can put the back of your hand sa nose, if there is warmth, no, going out. Or if talagang hindi kaya, your cheeks, no? Your cheeks. Or if minsan you can hear the labored breathing, pwede. Pero these are the ways that you can test, especially if you don't have the stethoscope o yung ibang mga gamit. So that's for breathing. And then for unconscious people, where do you test the heart rate or the heartbeat? So lalo na if they are in shock or whatever, kung mahirap talaga to hold sa mga peripheral parts ng di ba, yung radial pulse, the brachial pulse. Pag mahirap dyan, if you find it difficult to know, then you go to the carotid pulse, no? Kasi that's nearest. But of course, do not hold it both, no? Kasi makakat yung supply lalong makakat yung supply of the blood to the head. So you just go to the one side. So yan. For children, where do you feel of the children? So yung iba kasi sa dito sa groin area. So that's part. So that's for the heartbeat and the breathing and the consciousness. Ngayon, if you're able to wake them up, but they are groggy, no? Then you consider these tips, no? If you see the mnemonics here, the AEIOU tips. So, are they under alcohol? Are they drunk? O ba sila? Intoxicated? Kasi sometimes you can smell from the breath, no? Letter E is epilepsy. Did they have a seizure? Did they suffer a seizure? Or from heat stroke or heat exhaustion or hypothermia. So if you have witnesses, then you can immediately surmise na, siya, they had an epilepsy attack. Then I, it's insulin. some people have you look for medical bands, no, or records in their body that to tell if they are diabetic or any other illnesses. You have overdose or oxygen deficiency. Are they uremic? No. Sometimes you have the uremic patients usually are dark colored yung skin nila, and they have this parang fasces na and they do look like something na may problem with the kidneys. Trauma, of course, you can surmise us also if there's a car accident or they fell down. So yan po. And then, do they have infection? Do they have poisoning, or they have psychotic problems? And then also if it's cardiogenic or if they have stroke problems. So yan yung mga pwede. You can consider these things, especially for patients you can wake a little but are very groggy. But if you cannot wake them up, then you look if they are breathing, no? If they are breathing and they have a heartbeat, or then you assess furthermore. But if they are unconscious, not breathing, or even slightly breathing like gasping, and with no heartbeat, then you have to perform CPR. So cardiopulmonary resuscitation must be applied. So what are the basic? So I think you can easily find this online on how to do cardiopulmonary resuscitation. We will just discuss important I can just show you yung basic how to do it. But if you like the actual then you can marami po. Then you can look at the YouTube or anything to discuss. So to start very important step before yung mnemonics is we follow ABC. Airway, check the airway, the breathing, and then circulation. But now what is being followed is opposite. Circulation, airway, breathing. So immediately, for a person who needs CPR, you must do compressions to enable the blood to circulate immediately. And they say, even many studies have said that this will ensure maximum chances for survival if you do the compressions. Even just the compressions without the breathing, without the air, breathing air into the mouth. So yan yung pinaka-importante, the chest compressions that must be done in cycles of 5 to 7, and then reassess the patient if they already have heartbeat and slight breathing. So yan po yung gagawin. So if you look at yan. So make sure that you are on top of the epigastric area dito sa my sternal side of the middle, no? Then you kneel on the side of the patient, and then you place, it depends on you if you're more comfortable with the left hand and the right hand over, or the right hand and then the left hand over. Place it on the sternal side, no? And then on the bottom part ng sternum, near the epigastric area, on top of the epigastric area. And then make sure that your elbows are straight and your back is straight, and then compress, using the weight of your whole body without bending the elbows, So yan. And you should compress 1.5 to 2 inches down. Some compressions may injure the ribs, 50% of the time those who do compressions injure the ribs, but it's okay as long as you ensure the circulation with the compressions. Kasi if you do not do that, then yung danger rin na pwede mamatay, the patient can die. So you do that. It's 30 compressions in 2 compressions per second. So ano yung yung common nila na ginagamit na kanta to do that? Yung kaya lang kung alam nyo pa yan, hindi nyo na yata panahon yung Staying Alive, no? Ha 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 ha, staying alive, staying alive. So ganun yung yung song na pwede nyong gawin for pacing, no? 30. Usually if it's CPR, so after 30 pumps, you give 2 breaths dun sa mouth, no? And how do you do that? You extend, no, the neck and then pull the chin up, open the mouth, and then 2, and then another cycle of 30, and then 2. So after 5 to 7 cycles, that takes about 2 minutes. Then you reassess if breathing na siya or with a heartbeat na. So yun. But if they're still not breathing, then you still have to go, even if there's a heartbeat already. So yun nga. So yan yung Another song they say is ano yun? Quit playing games with my heart. Ano ba yun? Sino ba yung kumanta nun? yun eh. So it's the same quit playing games with my heart. So it's like staying alive, staying alive. So ganun yung pacing nung mo. It will give you 2 pumps per 1 second. So yan. Ayan. So ito sa bottom, yun yung how you give chest air, no? So paano ka hihinga? You close the nose para yung air lahat sa mouth. You have to extend and pull this up para mag-open. Kasi if not, baka babalik lang the air will return without going to the chest. So make sure na mag-expand yung chest. Just 2 breaths. For those who are equipped with first aid equipment, no, kung swerte ka na may dala ka, you can, to make yourself safe pa rin, you can use this. This is a barrier. No? You can put this sa mouth ng patient and then you breathe here. So ganon. Nakaganon sa mouth ng patient and then so, lalo na if they are kunyari may suka or they vomited something after cleaning it. Okay? So yan yung that's for the CPR. So make sure na you assess first. Theoretically, let's go a little into the politics of emergency medical care in the Philippines. We know naman the Philippines, yung poor healthcare system natin does not really afford. We still have no law on pre-hospital emergency medical care. Ngayon pa lang po tinutulak yan. Actually, they've been pushing that since 2004 with the wife of Joseph Estrada pushing for a bill in Congress. And then later on, yung Philippine Council for Emergency Medicine, the group of doctors who are into emergency medicine, were trying to push for a bill on emergency medical services and trauma services. So yan yung yung example diyan. Yung isa sa mga inaano nila, magkaroon ng mga emergency defibrillators sa mga public places. So yan, tapos may mga yung ambulance, tas ayusin niya yung mga 911 natin. So at meron naman tayong 911 pero I think it's not, kung meron kang yung ambulance, wala namang maayos na ambulance. There's no systematic and national level wide na emergency response services. But theoretically, if you have for a first aid to be successful, from assessing a patient, immediately yan, if you recall, kung nanonood kayo in movies, no, while before giving first aid, you will say, yung first aider will tell somebody na, please call 911. So, yun. So, actually, before you give first aid, you should already activate emergency medical services, no? Kasi what good will your first aid do? You cannot pump for a longest time without emergency medical services being, waiting for, somebody must come for to bring the patient to advance, to a hospital or to a unit of care that will give advanced services. So that's the flow, no? For us to be able to give successful, that will be assessing the patient, then call for emergency medical services, then do CPR, and then if need to defibrillate, then when the emergency medical services are there already, defibrillate the patient, then bring them to advanced medical care. So yun yung chain, no? That should be the chain. But of course, that's still something we have to fight for, no? It should be part of the right to health, no? So yan po yung ano natin, okay? And then, so again, to remind, ano, do not move the patient without proper assessment. Then make an initial assessment methodologically from top to bottom, front, back, side, and then you apply first aid where and when it is needed. No, if there is a problem with the neck, for example, there's an injury, no, a car crash wherein or a motorcycle accident wherein the patient was thrown off and then possibly hitting the head and ano, then it is dangerous to move the patient. But you have to put, but for example, they're still breathing with heartbeat and you need to transport. You have to immobilize first the neck. Ngayon, how do we get a neck brace if we don't have ano? How you have to improvise. Neck braces can be improvised by putting sometimes we use any soft ano. If they have you bundle up a towel or anything soft like plush na mga toys, no? If you have that, kung meron naman mga matatawagan somewhere or near the patient, then they can give something na you will put on the neck to and then tie it loosely, secure it loosely, and then para lang hindi niya ma-move or nobody when you are transporting the patient not to move it. And then yung picture dito is the log roll technique. It's the way to put a patient on a rescue board, no? Or anything that's hard that you can see around. Sometimes if there are door, no, na parang not being used, or any wooden plank or any wooden ano that can carry the patient, then you can use that. So if you see here, no, with the neck brace, somebody will secure the head, and then two people will with overlapping middle arms nila will secure that side of the patient and then turn him papunta sa kana towards them, and then somebody will place the rescue board sa under him and then put him back slowly. So they will move in unison. So they will pull the patient towards the right, towards the patient's right, going to them, with the lady here turning also the head at the same time. So yan po yung how you do log roll, no? Especially for patients who have possible neck injury, conscious or conscious after if they are breathing, and but if not, no, you have to perform CPR first. So yan po. Okay? And then look for other injuries, wounds. If they have a puncture, a penetrating wound or sucking wound sa chest, then you have to also manage that immediately. And then, yeah. If there are wounds, then you have to dress them, stop the bleeding, dress them, make clean it a little, and then if they have fractures, then you have to put on splints for further management. Okay? Okay pa po kayo? Then, sige, we continue. When you see a patient that has a difficulty in breathing, there are many possibilities. What are the possible causes? Usually for young females, no, that's hyperventilation, no, yung masyado na excite or they have a stressful problems that they can they hyperventilate, and so the oxygen levels of the body go down. They will feel panicky, and then they will have this numbing sensations on both hands and feet, and then some of them will lose or may faint, no. So, or is some will not faint but will be so weak, and then when they come to you, they will complain of the numbing of the hands and then breathing heavily. So yan yung that's one of the possible causes. Some have if they have chest injuries, they have been shot or stabbed, no, and some have yung heart attack, no, And then some have attack of hika or asthma. For hyperventilation, if you assess them as a hyperventilation, then just relax. Put them in a place that's with a shade, no, airy, and then relax them, no, and calm them down, and then let them breathe in a brown bag to balance na to bring back the carbon dioxide level, to balance the oxygen and the carbon dioxide level. So that's and then if some of them have not eaten yet, then later on when they have calmed down and they're okay, then you let them eat if they are not nauseous or not vomiting. So yan yung for the hyperventilation. A lot of patients sometimes we get from our hyperventilation patients. So usually these are young women that sometimes excited sila dun sa activity, they forget to eat, and then they join the so that's what we do. In the emergency room, sometimes you get this also. Before in the ambulatory unit, when I was a medical student, we get these patients, no, mga usually mga problems with the love relationship, no, sa break, so ganyan, and then they come in unconscious. But what we do is actually we test them, because sometimes when they're lying down, and then if they're really unconscious, no, when you hold their hands up and then let it fall, they will let it fall on the face. Babagsak na lang yan sa part ng body nila anywhere. But sometimes, yung fainting nila is due to hyperventilation na hindi naman talaga fainting. They just want to not move and So when you raise them and then put it, minsan iniiwas nila. So that's one of the tests that we do before. I don't know if it's still being used now. Pero yan yung isa for hyperventilation. For penetrating injuries on the chest, why are we mentioning this? Baka lang ma-encounter nyo. Usually when you see penetrating injuries sa chest, may hissing sound dito sa kasi my wound usually 1 inch long, open or long. Tapos may hissing sound or there's bubbling, no, with blood. So you can hear it, tapos may bubbling with blood or there's bleeding. So immediately you have to, that's a sucking wound eh. So ang problem dyan, hindi mag-expand yung lungs sa loob, and then blood will pull in. So what you do is you stop the bleeding by putting pressure and at the same time covering the wound. Not only with not only with gauze or any tela, pero with plastic. Why? You have to cover it with plastic so mako-cover yung wound. So when the patient breathes, the air will not be sucked in from outside. You do not close the wound, only 3 sides of the wound, so that when he breathes out, lalabas pa rin yung air. But when he breathes in, the air will not come in. So yun lang yung yung principle. You have to cover it. Some will cover it with with yung what's it, credit card. You can use that. But you cover only the 3 sides. So ang mangyayari doon, when the patient inhales, hindi papasok yung air through that wound, pero when he exhales, pwedeng lalabas doon sa side na walang. So the principle is like that for penetrating, and until you bring them to a center that can take care of them. So those are the basic for first aid, sa initial. So if you have many injured, then somebody must you must assess everybody and then take care first of those who are severely injured, Of course, the dead ones, wala na. We cannot do anything anymore. So you start off with those who have still a chance to live pero are severely. Those with scratches, actually they can you just manage them a little, or then they can actually help out others. So yan po. So yan na. So now we go to the wounds. You get wounds also. So I think some of you already know how the first aid of wound management is. So wound management, the layer of the skin. So epidermis, the dermis, and then the hypodermis. The nerve endings are where? In the dermis. And the basic of wound care is control the bleeding, prevent infection. And how do you control the bleeding? Well, controlling the bleeding through direct pressure. So yeah, either you, so the wound is here, no? So direct pressure using a clean cloth if you have no gauze, or a gauze if you have, and then putting the hand over that. So yun. And then what else? Put it up against the heart. So it will prevent also bleeding. So if it's in the lower extremities, you can have the patient lie down, or kung lying down na, then you do raise the lower extremities. And if the bleeding is very strong, then you use a tourniquet. So I will just show how you use a tourniquet. You can only use this on the appendages, sa paa, on the foot, or on the legs, or the hands, or the arms. It will prevent massive bleeding, especially if the bleeding comes from the artery. But make sure na you do not do this for a long time, because it will result into cutting off the circulation on the appendages. So if the strong wound is below this, no, sa hand, sa arm, the lower arm, then you have to stop the bleeding. Kunyari na near amputation. So you wrap a cloth, or if you have an elastic bandage, better. And then you tie it around, and then using a stick, you tie it also dun sa bound na edges, and then you turn it to make it tighter. Maging tighter yung band, and then you stop that. If this will be done for a long time, then you have to relax it once in a while, every 5 minutes, and then put it back again until makapunta dun sa center. Or if you can manage the bleeding itself dun sa affected part. So yeah, you can also put a bandage roll to ensure, no, to ensure that para ma-compress yung artery that is being that's bleeding, or the source, the main artery. So okay. So yan po. And how do you prevent infection? By cleaning the wound. If you have agua oxinada that you have brought, or just plain water and soap, then that will be enough. We also place here guava decoction, but that is not readily available, especially if it's a first aid situation, because of its antibiotic property. And then, of course, but I think the anti-tetanus injections will be done already when they are already in the formal setting of the hospital or center that he will be brought to, or the patient will be brought to. So the basics of sugat or wound is, for the type of wounds, you know that you have the closed wound, which is what we call pasa in Tagalog, or contusion, or if it's not only contusion, is like bleeding lang sa sa mga dito sa ating sa skin and the surrounding but if it's hematoma, there's really blood formation already. Big so that's one type of wound. So like yung black eye when you get punched. So the basic lang here is cold, immediately. Cold compress in the first 24 hours. Why cold? To stop the bleeding inside. It will compress the capillaries and then after 24 hours, to facilitate the absorption of the blood, you have to put naman warm compress. Okay? So that is after 24 hours. So that's for contusion. For the head, pag nabugbog yung head, and then sabi na concussion. Okay? For open wounds, we have different types of wounds. Hiwa is a clean cut done by blades, knife. So it's called incision wounds, diba? Very clean cut. Then we have putok na sugat, which is not a clean, like if you have broken glass that cut you, then you have laceration, but it's still a cut, just not clean cut. If like you get into an accident or a crushing injury na talagang it's not a clean cut only, but the getting getting avulsion. So ang tawag dyan is avulsion or pilas, no? So yan yon. This is that one. So it's an uglier type of wound. And then you have a puncture wound or natusok. Penetrating wound is one that penetrates so from here lalabas yan dyan. Impalement, like workers falling down tapos na sila sa mga metal mga rods. So there are those what we call impalement, and they go to emergency room with the metal sticking on their bodies. And then gasgas is the typical abrasion, the gasgas, and then the putok na sugat. Okay? So amputation is a type of avulsion wherein the part of the body has been completely severed off. So yeah. Gasgas is very painful, no? Kasi it affects the dermis with all the innervations, with all the nerve. So it's just cleaning it, a little betadine or the bayabas again or the guava decoction, and make sure. Actually, it's better to air it, no? Not to cover it anymore because it will dry faster. But if you have to go out, then just cover it with the antibiotic ointment and then cover it with a very thin gauze just to protect it from dirt. And then for the laceration, the incision wounds, for the laceration, just wash it. If it's not strongly bleeding, but if it's still bleeding, then you put pressure, of course, and then make sure that do you need to suture it or to close it? Because sometimes it depends on where the wound is, how big it is, and then how deep it is, and for sometimes aesthetic purposes also. So that is So you will, the same principle applies. You stop bleeding, you wash, and then if it needs to be sutured, then you go to a center that can do that. Sometimes it's just a small incision wound that is not in a movable part of the body, you can apply the butterfly bandage. So the butterfly bandage is just like this. So it's very simply explained here. You just take a strip of the bandage and then cut it so that the middle part would be thin enough to act as a parang suture style siya. So that's what you do. This is the sticky side, then you cut it like that, and then you stick this so that it will be thinner dito sa middle side, and then that's what you put over the skin. So you will put that on the part that is with the laceration. That's what you put, yung narrow side, to make it to stick it together. So para kang nagtahirin, but using this, using the tape. No? So that's just the simple way to use a butterfly without having the sutures done on you. But this will apply only if talagang manageable. But if the wound is on areas na you are moving it a lot, like here, on the mouth, di ba minsan nagkakaroon tayo dyan ng wound, then you have to have it stitched. Kasi bakit? Even if you put this, the butterfly one, you're still moving it eh. So it has to have a stable source of it has to be sutures. Kasi aesthetically, if you do not put sutures, then it will always gape open, making healing very long. So yan po. And then ma-open pa siya for infection. Okay? So yan. Yan yung principles for doing that, for wound management. So when to suture, when not, no? So it will depend on what part of the body. So yan po. Okay? And then the puncture wounds, of course, the danger of anaerobic or yung ano ng mga tetanus, no, infection, especially if the sources are dirt, no, dirty ano, tapos yung may rusted na mga things or may kalawang. So what you do is, if you have puncture wound, as much as possible, if you can let the wound bleed and then wash it also. If you have syringe, no, you can, if the hole is large enough for you to able to insert a syringe without the needle, the syringe lang, then you can pump agua oxinada into the wound area. But this is just first aid. Do not put any more bandage. You just have to apply yung anti-tetanus if it is needed. If for the last 5 years you have no booster shot, then you have to have the protection and as well as the immunization again to boost your immune against tetanus. Okay? So, and also the antibiotics for that. So, yan po yung sa puncture wound. For avulsion, no, or for the amputation, it usually happens in the fingers, the hands, the feet, the nose, the ears, no. It depends. Some are like yung mga machine shop operators, for farmers, no, who drive tractors, or if you get the club, or even gunshot wounds or a grenade explosion. So parts of the body will become avulsed or be amputated. So it's important to preserve the part that was amputated, put it in a bag, not wet it, do not put it in water, just put it in a bag, and the bag must be sealed, and that we will put that in the cold water or with ice, and then bring them. So the grace period yan is 4 hours, I think, 4 to 6 hours. So yan po. And then of course the part that has been that's retained, you have to clean it also. Stop the bleeding. So yung pa rin yung principles. Okay? And make sure to prioritize strong bleeding, the wounds with strong bleeding, especially bleeding that is bright red because it must be arterial bleeding. And then control yan either with tourniquet or direct pressure. Then if the patient is in shock, no, later we will discuss shock, then do the proper management for shock, and then control, ayan. Yun. So yun po. Okay? Okay pa po kayo? Sige. Please lang kayo if you want to ask something or may gusto kayong And then if it's an open wound with nagja-jut out yung bones, no? Make sure to clean it also. Actually, the best daw is saline solution if you have, and then cover it with gauze also. So yun pa rin, anti-tetanus. Then if it's a fracture, then you have to apply splint. Cover it first, then apply the splint, and then bring them to the hospital or to the center or to where. So yan. So what are the side effects if you do not take care of wounds very well, no? So yan, pwedeng magka-infection, you can also suffer from gangrene or talagang mabubulok na. Ayan. So yan siya, no? Okay? And then what are the signs of infection? Yung sinasabi nga namin na pamamaga, so inflammation, redness, there may yung pagnanana, no, may discharge talaga, yellowish na and then you have fever, pwedeng may inflammation ng mga lymph nodes where yung tract ng lymph nodes. So example, you have one common yung mga ingrown nail na pinalinis tapos nag-infect. So usually yung mga lymph nodes nila yung sa likod ng likod ng knees, yan, sa popliteal area ba yan, no, yan. So yan, sa hands naman dito sa kilikili, pag ang infected dito. So dito yung mga lymph nodes nila. And then yung pain sa wound. So yan. So ayan, to prevent infection, make sure na treat the wound with antibiotics, and then make it bleed, no? Para malinis. Parang natural cleaning mechanism yun. With just water and soap kung meron, or yun nga, guava decoction or agua oxinada if you have. Make sure na if you will use others like clean cloth, and then yun. And make sure na wait. Yan. If we clean a wound, no, with agua oxinada or any it's from the center. This is the proper way, from the wound going out. Not the opposite side, because you will be bringing in dirt from outside towards the wound. So, pabalabas. Not like this, because it's the same, you will be bringing in dirt. Not like this, okay? And then, you put antiseptic, whatever you have, betadine, and then you cover it if you will go to a place for insects or whatever, or if you will transport the patient. Okay, so yan po. And for head injuries, no? So head injuries may be skin level, dun sa ilalim ng skin, dun sa kanyang muscle, pwede rin dun sa skull, or dun sa loob na sa brain. So yan yung mga pwede. Ang problem sa injury ng pag nawalan ng consciousness yung tao, or nawalan ng malay, if they faint or they become unconscious, so you will have a difficult time assessing a patient. But just the same, it's also a danger sign. For the children naman who yung nagkakaroon ng head injury but awake, you have to observe them also. So our usual observation time dyan is 24 hours, no? So if they you have to assess also if they are vomiting, or there is hypertension, or also take the vital signs if you have the necessary equipment. So yan yung important things to look into, especially if the patient is unconscious na. And then if there are depressions also, you have to feel also, because that is a sign na merong scalp fracture, no? Without benefit, of course, of the x-ray. So you have to feel also. If they are bleeding from the nose or the ears after a high impact injury, then you are considering in skull injury. Kasi bakit? The nose inside, no? Yung base ng brain natin, base ng skull natin is there, no? And may connection. Sa ears naman dito sa side, sa temporal side. So, yan yung mga or if miski sa eyes, kasi ibig sabihin yung orbital part. And then brain na kasi. So, these are the signs also that you are considering skull injury. So, yan. Okay? So, yan. These are just the pictures. So, it doesn't mean that you do not see injuries outside. There's no injury inside. Especially kung wala na silang, they have lost consciousness. So you really have to assess if there is a leg injury, neck injury, or spinal injury, then do not move the patient. No? And you put the protection sa leg. And then do the lag roll technique if you need to transfer. And if the patient is vomiting, then you really have to put them on their side para ma-prevent yung vomit niya from entering the lungs. So you have to be very careful. So yan po. Okay? So yan yung para sa ibang injury for the head. And then we go to fractures. So what are the signs or for fracture? So ito na naman, there is pain, there is inflammation, redness, and of course, klaro naman, if it's not straight anymore, there's deformity, then most probably there's fracture inside. Numbness, pwedeng may open wound, and then you cannot move the injured part. No? So you really have to assess, and then ano yung unang lunas or first aid for that? To prevent, usually it's pain eh. So the patient has to be placed in a comfortable position, and then for the sometimes putting it into the natural or putting a splint on it will help lessen the pain. Tapos i-rest siya, do not mobilize it. Huwag mong igagalaw. So, and then put ice to lessen the inflammation. And then, if you can raise it, no, above the heart, no, it's better. It would be better. So, what is the importance of putting on a splint? So, it will provide immobilization. So, if you will immobilize it, it will lessen the pain, and then may also help in lessening the inflammation, yun, lessening the pain, and then it will lessen additional injury because sometimes it will also hit, no, the fracture can hit an artery or a vein. So yan yung what we try to prevent is complete dissection of these vessels to prevent bleeding. Okay, so you have to immobilize it. And then what are the principles of putting a splint? Make sure that if you put a splint, you do not compromise the blood supply. And how do you test blood supply? Of course, you pinch if it's in the appendages, you pinch yung nails. So if nagre-return yung redness, so it will become pale for a while, a fibrin, and then when you remove your hand, it will go red again. If pale talaga siya and it becomes cold, baka naputol or yung blood supply niya. And of course, if there is numbness, no? Or if the feeling is still there, and of course, yung movement. So yun yung circulation, and then the feeling, and then the movement. The principle of putting splint is one joint above, and you will secure the one joint above the injury and one joint farther from below the injury. So for example, if my fracture is here on the lower arm, I will make sure that above the elbow, my splint will immobilize the elbow and the wrist area. So yun yung principle. If the injury is on the upper arm, I will make sure that I will immobilize the elbow area and the shoulder area. So yun yung principle of a fracture. If my injury is in the upper leg, what will I immobilize? I will immobilize the knees and the hip, yung hip joint. So, yun yung principle. Okay? If sa fingers, if I have a fracture here, I will immobilize the connection of this with the palm and the middle joint. Okay? So, pero actually, you can just put the splint here na magko-cover that hole. So, I cannot bend it also. So, it's immobilizing the part connecting the palm. So, yun po yung principle ng. So, yan po. So, how do you make? You can use newspaper or yung sa probinsya, they use the body of the banana tree. So, ginagamit nila yan. For tying them up, yung mga elastic bandage if you have, or a long cloth na very thin. So, yan yung mga pwede. So, ito, newspaper, or any soft material, or any, that you can roll up, towel, that something will bring, will give, a comfortable also covering, and then before you tie it up. So, yan po. So, if, for example, ito, no, if I have an injury sa upper arm, I will put something hard, no, covering from the shoulders around the elbow part, and then tie it up with a bandage. But then again, you are not immobilizing yet the shoulders. So what do? You put this triangular bandage so that they cannot move it. So hindi na mag-move. You will not move anymore the shoulder part. Some will tie, some to prevent further movement actually, kasi they can still put it like that eh. They will tie the patient. Hindi na ako. So you can tie actually around. So ibig sabihin, you can tie an elastic bandage around the right upper arm going under the left armpits para hindi niya magalaw. So yan yung yan yung principle ng pag-splint, okay? This one, actually, this is a splint most probably of the upper, yung upper leg, no? Bakit? Kasi tinali hanggang sa waist area so that you cannot move the waist. So yan po. But actually, you need to tie this to the other leg para talaga hindi magalaw. But I think this is okay na kasi meron na siyang splint. So the whole part. So yan. Ito for the lower leg. So ibig kasi kasama yung feet, yung ankle joint. So naka-immobilize din yung ankle joint. Okay? So you can find ways on how to improvise if you have no proper equipment. Pero yan yung mga pwede mong gamitin. So for that, you have the very versatile na elastic bandage. When you apply elastic bandage, palabas ha, when you put it, hindi pa ganito. Not like that, kasi it will be hard. So make sure that it's out. The rolling is outside. Okay? So ganyan siya. Not like that. Not like that. Okay? Pag ganun. And then, this is also very useful, yung yung triangular bandage, which you can also modify as a cravat. So, ang kakravat is, fold mo lang siya to make it a long, so aside from kung wala kang triangular bandage, kung wala kang elastic bandage, you can use this. So, pwede siyang, kung nandito yung injury ko, so I can put it like that with a gauze. So I can tie it na like that. Or, kung nandito sa likod, so maraming ways na i-improve. So ganun. So yan. So this is a very versatile na thing that you can use to, so covering up wounds for transport and then also for splint. Okay? Next. So dressing. So any any cloth, no, that you can use to cover up the wounds, no, and to protect them from getting dirty, or bandage, no, if you have, or the gauze. So the gauze, so maraming type of gauze. So yan siya. So make sure that dressings are clean, not really sterile if you don't have one, or the cloth, and then it will cover the wounds and then provide enough pressure to prevent if you have elastic bandage, better. And then if it's in the hands or in the feet, no, make sure do not cover or miski sa splinting, do not cover the toes. Why? Because that's your sign to look into if you are cutting the circulation. If it's too tight, no, make sure that you are able to see the toes so that you can see yung test, yung movement, and then the circulation. So make sure. Yun nga lang, yung iba naglalagay ng mga manicure, so medyo mahirap yun if they put on those things kasi you cannot see the circulation. If they can remove it, no, or if there's time. Yan. Then make sure that it's not too tight and not too loose, no? Enough lang to secure it. Okay? So these are other ways, no? So this is the bandage. This is the triangular bandage that you can use as a cravat. So these are the different ways. So you can study that na lang kung paano yung application. Hindi practice, no? Kasi one important thing of binding, no, is yung figure of 8. It's all yung you learn the figure of 8. Yan. Yan ang figure of 8. Bakit maganda yung figure 8? Kasi figure of 8 will ensure yung nakaano siya. It will oppose the wound or whatever, then put the right type of pressure. And then maayos yung pagka-bind mo. So yan po yung principle. Okay? So ito pa po yung ibang So these are ways of binding wounds or ensuring yung yan, for binding wounds na to. Sa arms, sa hand man siya, sa knees. So yan po. Sa head, iba-iba. Tingnan nyo yung figure of 8. So it's opposite yun. Left, right, ganun lang siya na tile. Okay? And then, ayun po. So that is for the wounds and the Hindi ko na kayo kaya. This is a first aid kit that we have. So may mga gauze na dyan, yung bandage and everything that we can use for And then ano pa? Well, usually sa mga rally, yung hilo, no? So yung dizziness, so usually yan, they will feel dizzy, then they will have they cannot walk anymore, then they will say that parang nabablocken yung kanilang pagtingin, no? They cannot see, they will lose consciousness, tapos parang lightheaded. And then some of them parang nauseous, and then some of them talagang they cannot continue anymore. So there are different causes for this. Hunger, tingnan nyo na mabuti. If the patient really is still young, tapos no other concomitant diseases, then ask them if they ate, no? Are they too tired? Were they stressed a few days before, preparing for the mobilization? So yan. Or if it's too hot, tapos very sweat, yan. So tingnan nyo. Are they hypertensive? Do they have diabetes? Do they have asthma? So yan. Are they pregnant also? Yan. So yan. Yan yung mga possibilities. And then what do you do? Of course, you place the patient in a comfortable position and a comfortable place. Kung may first aid sasakyan or then you can do that. Or if may sila tent that you can put them in. Then you let them lie down, loosen the clothing, ensure na merong area, they are with the proper ventilation or Tapos put them in a comfortable position. If okay naman yung blood pressure nila, just let them rest, and you can let them smell anything strong, herbal o yung mga herbal na mga preparation na you can use, spirit of ammonia, yan. And then yun nga, then you probe what is the cause of the pagkahilo. And then if after 15 minutes, then talagang ganon. And then ang important dyan is the vital signs. If pag the blood pressure is falling or the heart rate is very fast, then you have to consider bringing them into sa hospital. Kasi you have to consider also it may be cardiac, baka sa puso. But actually, if parang impending heart attack yan, then you have to put them on a sitting position with the knees bent, no? Tapos naka-rest sila. So that's the best position for yung mga baka heart attack or nag-angina. If they have angina medicines, then you make sure to give them. Mas maganda nasa first aid kit nyo rin yon. And probably aspirin also. Kasi yan yung mga immediate. Okay? Okay. And then, let's go to heat exhaustion and heat stroke. Heat exhaustion and heat stroke, ito yung sobrang due to extreme weather conditions, very hot, no? Very sunny, tapos very dry or very talaga, patient can suffer from heat stroke or heat exhaustion they can become feverish, no? Or parang ano sila na nanlalamig, no? Oo. And then some will break out into extreme sweating. They will feel tired, no? And then very weak. And then their pulse will become bradycardic or mabagal yung pulse. No? So what do? If you suspect heat stroke or heat exhaustion, then you put them in a very cool place. Tapos you air mo, i-fan nyo. Then let them lie down with the legs raised, no? Then luwagan yung damit or take off jacket kung naka-jacket. If they are conscious, if they can drink, no? I-raise nyo ng konti with anything that will replace kung may Oresol or Gatorade or whatever that can replace the lost fluids sa body. Pero if they are unconscious, syempre you have to apply CPR if there's no heart rate or heartbeat or or breathing, and then you have to bring them into the hospital. There's a difference between heat exhaustion and heat stroke. Heat exhaustion is the parang middle ground eh. Yung heat stroke talaga yung mas severe. Yung heat exhaustion, the body can still control yung ng temperature, no? So the temperature of the body is still normal. They are still able to produce sweat, no? So the body is still cool to the touch when you touch it. They are still sweating. Okay yung iris nila eh. Kasi compared dito sa heat stroke, the iris are contracted. Eh. So they are still thirsty. They will still ask for water. Cold, pwedeng cold, clammy, or a little warm yung skin nila, but they're still moist, no? Mafe-feel mo naman siya na may basa-basa pa siya. They may be dizzy, they will be nauseous, no? Tas conscious. Pero for those with heat stroke, pwedeng unconscious na sila, then you will feel na talagang very hot na yung kanilang body. Mag-i-increase yung temperature, warm, at saka dry and reddish yung skin nila. And then shallow breathing na mabilis, and then contracted yung pupil. So these are the difference between heat exhaustion and heat stroke. So before, sana exhaustion pa lang mahuli nyo na kesa sa pumunta sa heat stroke. Kasi especially for older people and young children below 4 and 6 na very thin lang yung skin nila. So very sila for heat stroke talaga. So yan yung babantayan. Tapos marami pa sa ating mga nagrarally, naka-jacket, naka-long sleeves, no? Kasi nga sa hot. So yan yung kailangan, So i-loosen yung clothing kaagad. So that's for that, So sa heat stroke, nawawala yung control sa central temperature. You lose the control of the central temperature. Ayun. So these are the signs and symptoms that we discussed that can lead to death also. So yun. Ito na yung mga sinabi ko kanina. If you have ice, then put ice on the armpits, dun sa groin area, and then sa neck area. Okay? And if talagang kaya nyo, yung wet na you wet a malong or any shawl, then you cover sa body. Okay? Okay? Convulsion. So there are different causes of convulsion. Actually, you cannot prevent it. Pag nag-convulse na, they will convulse. You just make sure that they will fall down safely in yung head to protect the head. Then loosen the clothing. And then, you protect the But yun, syempre, if they are patients with these types of make sure na may companion or wag lang muna mag-attend if they have something like that. So yan po. And then shock. So shock is a very big term covering a condition wherein the circulation of blood in the body is not working anymore. So yung lack of blood supply to the different parts of the body is very detrimental in the long run, di ba? So what are the different causes of shock? So kung may talagang overt bleeding, no, then it's hemorrhagic shock. If it's dehydration, then it's hypovolemic or metabolic shock. Pwede ring sobrang acidic kasi if you have poor insulin control sa diabetic. sa mga alcoholic, tapos yung pwedeng maging acidotic yung katawan ninyo, then you can lead to metabolic shock. Neurogenic, if you have injury, no? So yung especially sa higher up, sa brain or sa higher up na part ng ng nervous system mo, matinding pain, so that can cause also cardiac, syempre, heart attack, no? Respiratory, kapag hindi ka if you have problems with breathing like asthma, and then psychogenic shock, no? So emotional shock, and then septic shock if you have infection, and then anaphylactic due to allergy. So you know that shock is when the body starts to experience abnormal blood circulation. Ang nangyayari dyan, they will concentrate it in the major organs. So sa heart, so other parts of the body, mawawala na unti-unti ng So it will become cold, clammy, yan. So to start. Tapos bibilis na yung heartbeat, tapos bababa yung blood pressure will fall down. And if the capillaries and the blood vessels will continue to contract, na later on, opposite yung mangyayari doon, magpupull na yung blood doon. So effectively, there will be no effective circulation going around the body. So ang nito, they will be deprived of oxygen, substance, and everything. So yun yung yung mag-contribute na later on na magsha-shutdown yung iba-iba ng organs. And if this situation will hold on, no, at hindi siya na-hydrate kagad, hindi nabigyan ng blood or no, so it will lead to death. So that is shock. Pero syempre, we do not usually encounter that sa mga ganitong mga rally. But of course, kung meron talagang mga traumatic injury talaga, then that's the time. Ang lang dito is, the blood pressure will be below 90/60. Tas yun, tachycardic siya, mabilis. Tas pale na yung skin. Tapos bluish na to kasi lack of oxygen nagkakaroon na ng lack of oxygen, cold and clammy, mababaw yung breathing, tapos disoriented na. Yung iba will always ask for kasi now they are thirsty, there's no more urine coming out, and then nag-enlarge yung iris. Pupils pala, sorry. So, make sure if whatever form, kunyari due to allergy, severe anaphylactic shock, or kaya sa o kaya may heart problem, make sure na they are breathing and may heartbeat pa rin. So you do not need to apply CPR muna. But you have to watch out. And then, make sure na walang nagbablock sa kanilang airway. Then, loosen any clothing and then put them in a shock position here, no? And then, mga 6 inches yan above the ground, yung legs nakataas. And then, if there is bleeding, you have to stop the bleeding. But if it's internal, then you really have to bring them to the hospital. Yan ang shock position po. Maari ding angatin yung dalawang paa. So, yan po yung So, yan po yung for the shock position. If the patient has difficulty breathing, ito yung position. Make them like that. Okay? If the patient is breathing and breathing and with heartbeat, and then with tendency to vomit, o kaya may injury sa head, ilagay siya dito sa what's called this the coma position. Why? Kasi it will facilitate better breathing. Mas maayos na breathing for the patient. So how do you do that? Ito yung parang after CPR then, if they are breathing already and with heartbeat, then that is what we call the recovery position. So ililay niya siya sa isang side. Kita niyo yung kung sa right side, yung right arm niya nandun sa ilalim, with the left arm at a 90-degree position dito sa and then the left leg, yan, naka 90 degrees din. Actually, naka-straight dapat tong right leg. Tapos ito, naka Ganyan siya, over the right leg. So yan yung recovery position. Then you calm them down, and then if they are in pain, then give them something for the pain. So yun na, yung iba pa. And then if you have blood pressure monitor and everything, monitor them regularly hanggang you can bring them to a hospital. Okay? So yan po. That's for shock. And if nawawala na siya dun sa shock, then yun, mas ano na siya, mas reddish na yung ano niya, circulation will continue, mawawala na yung bluish, the heart, the vital signs will normalize. So yan, ito naman mga ano na how to prevent shock. Make sure lang din na, kasi kung may mga diabetes, may mga allergy, you have the necessary medicines with you. Ayan. Okay? And then, ito na lang konti po. Burn. Ang ano lang naman sa burn is the causes. So, fire, hot objects, o ano, chemical burns, sunburn, tapos electrocution, and then sa lightning, ano. So, yung different degrees of burn. Pag sunburn is first degree burn. So, you just cool it down, and then, yung iba may mga ointment, yung Caladril, calamine lotion to make it more comfortable. Yung iba, yung aloe vera, no, di ba, mga siya, kasi cool. Pag second degree burn, ito nagkakaroon ng mga ano, ng mga, pag kanyari, na anuhan ka ng boiling water, di ba? Nagkakaroon na ng bullei formation. So, yan yung mga blistering na effect. So, nagkakaroon ng redness. So, kita nyo naman yan eh. You just put on wet, cold water. You can dip it in cold water for 5 to 10 minutes. Then, do not burst the blisters, no? Bayaan mo lang yung blisters. If mag-burst siya, then clean it, and then apply. Yung iba kasi they have this burn ointment, silver sulfadiazine. So, okay yun. Tapos, if later on meron ng dead skin, you can take it off a little, and then make sure if you go out, you cover it with the sterile gauze. No? Pwedeng may antibiotic. The third degree burns, actually, it covers the dermis, the epidermis, and then the subcutaneous area little. Yan yung medyo nagba-black na yung makikita nyo yung ano nila skin, and then yung, no. But not really reaching pa the, the bones, deeper structures. So, ang problem kasi sa mga third degree burn is the amount of fluid that you will, ma-dehydrate sila at mawawala yung mga essential na, So, you really need to bring them immediately to, lalo na kung malaking area yung sakop ng third degree burn. So, if there is oresol solution, then you can start giving them if they are conscious. Do not remove clothing na nag-stick dun sa burn area, no? Saka na lang if you are in in a hospital or a center. Then you put dun sa mga na burn na part, you put wet gauze or any wet cloth. Then you have to bring them to expert care. So make sure na you remove the patient from the source of burn, lalo na if it will be dangerous, and then give them enough na air or ventilation. Yun sa mga hindi pa nasunog na you can remove the clothing, and then if there's bleeding, then you have to stop the bleeding. Okay? Kung chemical burn, like acid or gas, then you irrigate it with water. Okay? So yun po. And then the other emergencies for the ears, the nose, and the eyes, no? Ito naman sa ears, yung mga napasukan na ng mga insect, or may loud crash na nag-burst yung tympanic membrane. You just stop the bleeding, maglagay kayo ng gauze, and then if you need to bring them already to emergency, then bring them. Nosebleed naman, hindi na ganun ang nosebleed, ha? Nosebleed is still sitting straight or down a little, and then pinching on the soft part of the nose for 5 to 10 minutes. So it's applying pressure also. And then sa eyes, ano ba yung mga emergency sa eyes? Yung parang acute or biglaan na pag losing or pagka-weaken ng sight, no? Then yung floaters, yung parang may nag-ano sa loob na something floating around, or merong exudate, no, na yellowish. That's not simply muta lang, no? Not just it's really oozing out, then that's emergency also. Or sudden pain and redness, no? So yung mga glaucoma, increase in pressure, or sudden blindness, no? Baka nagkaroon ng block yung mga arteries sa mata. Or if there's chemical, that went inside, naanuhan ng chemical or foreign object, these are all emergencies because the eyes you cannot, hindi mo pwedeng pabayaan yan ng 2 days, because it will really be hard to, irreparable yung damage once it starts na. So, yan. So, yan po yung for the eyes. So, sa mga rally, kung sakali lang, no, ito yung isa, tear gas, no. Tear gas is CS gas, it's chlorobenzyl malonitrile. What happens is yung chemical nito is it attaches to the pain receptors. And then it will enter the wet parts of the body. So ano yan? The eyes, the skin, the nose, dun sa mucous membrane, sa mouth. It will also attach to the hair and to the mga clothes nyo. Usually, if you want to be really prepared, although matagal-tagal na rin naman kami naka-experience ng, ako nakaano ng tear gas, but the same, it's still being used, no, sa mga ganyan. You have to, maliban sa gas mask, which is difficult to have always and bring always and to have this in the house, the simple cap and a bandana that you can cover your face, the head, if hindi cap, at least the face. So yung basta covering the head and the nose and the mouth, that you can wet, no? Kasi if it's wet, yung chemical will attach to the wet part na hindi na pupunta sa inyo. And if you can have goggles, no? Pero once it happens, kunyari nag-ano na ng tear gas, usually the tear gas kasi pag nag-explode na yan, there's an explosion in the container, tapos magsispray yung crystalline powder sa loob, magsispray niya palabas as a smoke, no? So yun yung mangyayari. But since it's very dense, ang tendency ng smoke, pupunta yan sa ground. So yung mga naapektuhan yan, you have to get them and then pull them out of that area and then bring them to something safe, no? Basta wala na yung But of course, kung ikaw yung first aider, you have to be protected first. Kasi kung hindi, pareho kayo na, you will be affected both. And then make sure if you bring them to that area, you have to wash them immediately. Yung eyes, yung face. Some will bring lemon or something strong to make them breathe kasi isa yan eh. It will increase the secretions of the mouth and the nose to the point na para kang hindi ka na rin, you cannot breathe anymore. And then the eyes, it will tear up, no? Yan. Until mamaya parang hindi mo na rin, it's the blurring of the vision. So it will cause you panic also. So you have to calm them down also, and then some use water and baking soda. That's 3 teaspoons of baking soda to 250 ml of water. Parang iwawash. Actually, they say it's not really that proven yet, pero they say it neutralizes the chlorobenzyl the chemical sa tear gas. So yun po yung basic for tear gas. And sana hindi naman din magamit, pero yun, ang niyan is, yan yung part nung tinanong yan before, kaya sinama ko na rin dito. So I think that's for the last slide, no? I cannot anymore demonstrate, pero I think you can have your time naman and then, dun, tingnan nyo na lang din dun sa, you can Google that a lot, yung mga binding, yung paggawa ng splint and everything. So yun, thank you very much, no? So very, daldal ako ng daldal. So I hope na natutunan kayo. And I think we have to go back to the questions before tayo Okay lang? Mahaba na ba?
Okay lang po.
Kaya pa? O sige, bago tayo ano. Oh, wait ha, balik ko yung questions. Okay? Ito hindi naman to contest, pero sagutin na lang natin sabay-sabay. O Clark, ikaw na lang mag-monitor kung paano ba to ibabalik. Ay, tata. Oh. Okay? So, tingnan natin kung naisama ko ba to sa discussion. Sige, before responding to first aid scenario, what's the first question you should ask at the scene? Pwede niyong sagot sa chat. And Clark, paki-monitor na lang. Ano, A, B, C, or D?
C daw po.
C, very good. Marami ba C? C na lahat. Perfect. Next. Ano yung number 2? If your victim is unresponsive, and has just thrown up, you are not comfortable giving CPR, what will you do? Wipe the face. A, B, C, or D? Wipe the face or cover with a shirt. Compression only CPR. Go get help. Do not initiate resuscitation.
Letter B.
B. Very good.
Answer na majority.
So, hindi ang sinasabi ngayon dun sa mga yung blowing, hindi naman, ang important talaga is the compression. Oo. But if you can do both, so ano nga yung, for adults, it's 30 chest compressions, tapos 2 blow, no? For children, it's 15 tapos 2. Kaya mas mahirap sa children, mas so yan yung So B, very good. How often should you recheck for a pulse when you're performing rescue breaths on an unconscious patient with a pulse? Oo. Sige. Yung kunyari nagbibigay ka ng tapos inaano mo siya, CPR mo siya. How often? With the pulse pala to. O kunyari without the pulse, sorry. How often should you recheck for a pulse when you are, sorry, bakit may pulse ako? Kunyari, sinipare mo yung patient. Kailan ka ulit magre-recheck for a pulse after doing CPR? Every 45 seconds, every 1 minute, every 2 minutes, every 4 minutes. May nagsagot ba?
Wait lang po.
Ito pala, walang pulse ha, sorry. Walang pulse at walang hininga sa CPR nyo.
Iba-iba po yung sagot nila, B or C.
Okay. C. Kasi actually after 5 to 7 cycles. So yung 5 to 7 cycles is usually 2 to 2.5 minutes. So C yung sagot. Okay? When should an unconscious patient be placed in the recovery position? Yung sabi ko yung coma position. Kailan mo siya ilalagay doon? If the patient has bradycardia is not breathing. B, if the patient has pulse and is breathing appropriately. C, if the patient has no pulse and is not breathing. D, if the patient has a bounding pulse and is not breathing.
Letter B po. Yung
Very
sagot ng karamihan.
Kasi not breathing yung iba. So, dapat nagsi-CPR ka. Hindi mo pwedeng ilagay sa Magre-recover. Pag recovery na, yun yung nakahinga na siya. Okay, tama. B? Oo, tama.
Apo, boy. Yes.
Sa basic life support steps used for adults, ano dyan yung tamang steps? Yung sunod-sunod. A, B, C, or D? Yung A, assess, give to rescue breath, defibrillate, and start CPR. B, assess, activate EMS and get AED, check the pulse, and start CPR. C, check the pulse, give rescue breath. Sinong sumagot? Anong sagot nila?
Mas marami pong B, pero may nagsagot din ng letter D.
B. Actually, B. B, boy. Kasi, assuming na dadating ka agad yung EMS. Pero, assess, tapos di ba sabi ko kanina, make sure na yung emergency medical services ay na-inform or mai-inform. Pero ito sa mundo to ng napaka-ideal. Ha? So, ganyan, uunahin yun. Pero actually, nagsasabayan na yan eh. So, nag-a-assess ka, tapos, kung wala nang hininga, pakicontact mo si ganito, tapos nag-CPR ka. Pero kung bibigyan mo ng order yan. Okay? 6. The recognition of shock includes A, B, C, D.
C po, yung sagot.
Okay, C. In prioritizing, ano ba to? Sorry. Casualties, which order do you follow? A, B, C, or D? Breathing, bones, burns, bleeding, others. Bleeding, breathing, bones, burns, others. Breathing, bleeding, bones, burns, others. Bones, burns, breathing, bleeding, others.
Letter C po, yung sagot ng majority.
Yes, breathing. Sabi. Okay. Pero di ba sabi ko may, parang kung titingnan mo sabi ko, di ba circulation? Pero actually sa CPR principles yon. Ito casualty. So kung i-assess mo, eh syempre, titingnan mo muna mga hindi na humihinga, pero may pag-asa mo pa ma-CPR. Pero actually, magsasabay-sabay pa rin. In the treatment of acute soft tissue injury, ito yata hindi ko na the acronym RISE stands for A, B, C, or D. Hinalo-halo ko lang. Pero ano yung RISE? Naaral niyo na ba yung RISE? May sumagot ba?
Meron po. Letter D.
Rest, immobilize, comfort, elevate. Ang answer is B. Boy, rest, ice, compression ng making comfortable position, tapos elevate. Okay. Pero actually kasama yung cold yung may ano ka. Kasi para ma-prevent yung dagdag na pag-extravasate ng dugo. Okay? Signs of heat exhaustion except contracted pupils, reddish or pale skin na moist, thirsty, sweating. Ano yung hindi kasama sa heat exhaustion? Contracted na pupils, reddish, pale skin na moist, thirsty, sweating.
Letter A po, yung sagot ng...
kasi yung letter A sa heat stroke na. Okay? What degree of burn destroys the epidermis and dermis hanggang sa subcutaneous? The burn site may look white or blackened and charred. A, B, C, D.
Halo po. May letter B, may letter C. Yung sagot.
Actually, C. C siya. Okay? Okay, so yan na. Sana nakatulong yung input. Okay. Thank you.
Thank you, Doc Julie, for that very insightful and very informative talk about first aid. No? Sana marami tayo natutunan because gagamitin din natin to, hindi lang for the mobilization in the future. No? As medical professionals, dapat basic sa atin yung marunong tayo or maalam tayo sa pag-conduct ng CPR. So now we're opening the floor for around siguro 15 to 20 minutes. If you have any questions, we can direct it to Doc Julie so that she could answer it. So,
sige.
Okay.
May masishare kayo ng mga kabagong kasi syempre.
Okay po. So, ayun, you could use the raise hand function. Pero pag nasa-shy kayo, pwedeng Zoom group chat na lang. So anyone may questions? Or parang comments, ganyan, or sharing? Ayan, we have our first question po from Amparo Isabel. Hello po. Due to COVID-19, is it possible that there will be changes in performing CPR?
For COVID, okay. Sige. I think so. Kasi nga yung di ba, you will always have to protect yourself, Actually, sinasabi nila, yung di ba sinabi ko kanina, compression only. Pwede yon. It's still as effective as yung tandem ng cardio at saka yung with breathing. So, if you really are not comfortable or hindi talaga kayo sure dun sa status nung bibigyan nyo ng CPR, then you can do compressions only. So kung yung nyo is kailangan nyo talagang i-protect talaga rin naman yung sarili nyo, then yun. Yun yung maganda dun sa application na yon na pwede pala yung compressions only until the time na yun may dumating na madala nyo na siya talaga sa hospital. So it's nag-swak lang talaga yung ganong na principle na pwede rin palang compressions lang. So it's as effective. Okay?
Okay. Any more questions? Siguro we could entertain around 3 or 4 more questions.
Sige.
Anyone? Ayun, baka may gusto kayong iklaro.
Oo. May gusto kayo i-share, yung mga life support recently, may mga sa inyo, ito before COVID, kung may nag-ano, or nag-attend ba kayo ng something. Kasi dati, iba yung CPR, di ba? Iba yung style. Ngayon nga, yung chest compressions, pwede na lang pala. Ano pa ba usually sa mga MOB yan? Yung mga heat exhaustion, yung hyperventilation, gutom. So, usual ano niyan.
Ayun, Doc, we have another question from Serenity. Hi, Doc. May we ask how volunteers check for bone injuries for the rise on a public scene without causing more damage to the patient?
Ay, bone injury? Kanina kasi, di ba, I mentioned the signs and symptoms para kang fracture, di ba? So, kung ano mo naman na, may possible na traumatize or na-injure siya, and then you look for the signs. Tingnan mo yung appendage or yung part ng body na ano. Kasi kung may outright deformity, talagang masasabi mo naman talaga na may problema yung bone. And then, with the initial na kumusta yung feeling, and then yung check mo rin yung circulation. So, pag hindi talaga niya rin makagalaw, you have to consider. Yung medyo mahihirap dyan, yung sa ankle, sa paa, yung mga natapilok. Kasi yan, minsan maliliit lang yan ng mga fracture na hindi mo ma-notice hanggat a few weeks after na hindi pa rin nawawala yung inflammation dun sa paa. Sasabihin do, hindi ko na nga ginagalaw, nakabenda na po, tapos hindi ko pa rin. Tapos pag x-ray, nakikita may mga hairline fracture. So actually, kung sabihin mong, yung tinatanong mo kasi sa RISE, kasi yung rest, it's a general principle that you will use pag first aid. So pag miski hindi mo pa sabihin na mukhang lang yan, na sprain, or wala naman yun pa rin, i-rest mo pa rin, lagyan mo ng cold compress. Kaya kami nagdadala rin kami ng ice sa mga mobilization kasi multi-purpose siya. Kasama yung paglalagay ng cold compress. And then, lagyan mo ng benda to compress it and then put it in kung kailangan ng splint. And then you elevate. So, yan yung mga general. So, yung for bone injury, it will cover dun sa diniscuss ko na namamaga, you cannot move it, there is deformity talaga. Minsan talaga, if the arteries are affected, minsan nawawala yung pulse dun sa distal part. So, you have to be very careful in assessing also. So, yun. I hope I answered your question.
Thank you, Doc. Another question from Monica. Doc, how about legal liabilities for the person performing CPR? Are there things to consider regarding legal liabilities?
Yes, I just read. Actually, you can be sued. Depende dun sa sa atin, kasi yung CPR sa atin hindi naman ganun pa ganon ka high-tech at although may mga gumagamit na rin, at marami na rin talagang gumagamit nagsi-CPR din. Pero sa totoo lang, kasi nga hindi naman siya yung ideal setup na nakadikit yung meron talagang emergency na matatawagan mo na 911 na very credible na pupunta. May danger pa rin na masuka. But, meron din sa international humanitarian law, yung tinatawag nating yung, sino to? Yung law na you help, man tawag yan? Yung you're helping somebody kasi napadaan ka or nandun ka dun sa sitwasyon na yon. So, if you help out, it can still be part of you extending help, which is within the bounds of the of certain international conventions. So sa international humanitarian law, ano ba to article? I forgot the name. Pero,
Sa Samaritan Law daw po.
Ayun, Good Samaritan Law. Sorry. Yun, Good Samaritan Law. So, wala pa akong actually experience na ganyan yung kaso na nakasuhan na dito sa atin. Ano? Wala pa akong naririnig. Pero, kung may ganong na pwede kang makasuhan, pero sa kabilang banda, meron din namang mga batas or mga artikulo sa mga international covenants, lalo na dyan, na magpo-protect din sila. So yan yung sa atin, sa ngayon. Sa Philippine setup, hindi ko alam, baka may alam sa inyo. Sorry hindi ako masyado. Pero yun pa lang yung alam ko regarding that.
Okay.
Unless may gusto mag-share.
Okay.
Sige.
Meron pong comment regarding the talk. Very great daw po yung program all in all. Pero may suggestion lang daw po since may foreign students, may nami-miss out na information. So, kung pwede daw po na may English yung slides.
I'll try to look. Actually, hinahanap ko Ang nakikita ko yung mga meron yata kaming English, pero sorry hindi ko nahanap yung English slides. Pero kung mapoprovide, kung gusto niyo ng copy, I can provide naman the English slides. I'll look for it, okay? Para
So, ibibigay niyo po sa amin yung
I'll try to look. Hanapin ko muna, ha?
Okay po. Pero yung Tagalog po, ibibigay niyo.
Naman. Wala naman.
Okay.
I-cite niyo na lang yung na ginawa.
Sige po. Okay.
Oo. Spread niyo ang love.
Okay, thank you po for that, ma'am.
Okay.
Siguro we could entertain like 2 more questions.
Sige.
2 more questions. Anyone? Or share. Pwede kayo mag-share, ganyan.
Share lang sa experience. Ano bang mga naano nyo?
Sige. Last call na lang siguro since baka wala naman ng question.
Sige.
Going once, going twice.
Sold.
Wala.
Okay.
Sold.
Okay.
I think that's it for the open forum.
Thank
Again,
you.
thank you, Doc.
Congratulations, PMSA.
Ayan, thank you po for your valuable insights and
Okay.
i-apply po namin yan in our future applications, no? Lalo na pag emergency settings. And thank you po.
Thank you.
Okay, so sadly, no, yung program natin syempre kailangan magtapos. And for now, for the closing remarks, I would like to call on Ms. L'Oreal Ann Aquino, the president of AMSA-UERM, to give the closing remarks and as well awarding of certificates for speakers.
Okay. Hello. Isang mapagpalayang hapon sa lahat. Okay pa ba tayo? Okay. So as our event, Paunang Lunas, draws to a close, I would like to once again extend our gratitude to all of the participants, our partners, the members of PMSA National, PMSA-UERM, and PMSA-PLM who made this event possible. And of course, our esteemed speakers, Sir Jigs Clamor and Dr. Julie Kagiwat. Thank you so much for taking the time to be with us this afternoon. And I hope that aside from learning first aid, you were also able to learn a lot about the human rights situation today. So maybe some of you were wondering before, nakikita niyo yung pubs namin, so why do we have to start off by talking about human rights? Why didn't we just focus on the first aid training itself? So I'm going to reiterate some points raised earlier. In PMSA, we see it as our mission to actively protect and promote the health, rights, and welfare of the marginalized, whom we vow to serve as future physicians. We believe in a biopsychosocial approach, that the right to health is interrelated to other rights. So how will our future patients know how to avoid getting sick if they've been deprived of the right to education? How will they have the time to worry about their own health when their sole focus is on surviving today because they've been deprived of the right to just living wages and proper working conditions? How can they practice social distancing during this pandemic when they've been deprived of the right to decent housing, when the political prisoners deprived of the right to due process are packed in their jail cells like sardines? So during the Marcos dictatorship, these rights were stripped from us. 70,000 Filipinos were incarcerated, 35,000 tortured, and 3,257 killed. Today, even without a formal declaration of martial law, what we see all around us is reminiscent of one of the darkest periods in our country's history. As discussed a while ago by Sir Jigs, it's the same, trampling over civil and political rights. More than 27,000 dead from only 4 years of the government's war on drugs. Red tagging, unlawful arrests, and the killing of oppositionists, members of the press, activists, human rights defenders, and IPs left and right. The repression of freedom of speech and closure of media outlets. Build, 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 again, focusing on infrastructures and beautification and white sand to hide the rotten system underneath. Blatant, shameless, and massive corruption, even in the midst of a pandemic. Like what Sir Jig said, what we have now is a de facto martial law, with the president once again holding the three supposedly independent branches of government and the military in the palm of his hand. Ang lagi ngang chinachant sa martial law protests, Marcos Duterte walang pinag-iba, parehong tuta, diktador, pasista. So anong pinagkaiba mula noon sa ngayon? The difference is, it's not too late for us. It's not too late to act now. Even with the Marcoses coming back into power, even with another dictatorship looming over us in the form of President Duterte, it's not too late. I am a doctor and the only thing I should fear is not being a good one. These are the words of Dr. Remberto Bobby de la Paz, one of the doctors who was murdered in cold blood during the martial law era, just because he indiscriminately treated patients for free, including suspected NPA members. Being good future doctors means being even better citizens, and it's our duty to make sure that no one forgets so that history doesn't repeat itself. Let us never forget what really happened during the Marcos dictatorship. Let us never forget those who sacrificed their safety and even their lives for our freedom, the mass leaders, the journalists, the student activists, the true doctors of the people, including Dr. Bobby de la Paz and Dr. Johnny Escandor, because no matter how much the people out there deny and revise history, we know who the real heroes are. And it's not the man who was secretly moved to the libingan ng mga bayani. And finally, let us never forget that the struggle for social justice is far from over. So let's make our voices heard, let's make our numbers seen, let them hear us chant, never again, all the way to Malacanang, while it's not yet too late for us. We've toppled a dictator before and we can do it again. Magkita-kita tayo sa kilos protesta sa UP Diliman sa September 21 at sana marami sa inyong piliing maging bahagi ng aming quick response team. Muli, maraming salamat sa inyong lahat. And before we end our program, we would like to call on our speakers so we can give them due recognition and their certificates of appreciation. Okay. So the Philippine Medical Students Association would like to award this certificate of appreciation to Mr. Ronnie Jigs Clamor for his invaluable sharing of expertise in PMSA's Paunang Lunas, an online first aid training given this 19th day of September 2020 as sponsored by PMSA PLM and PMSA UERM. Signed by Jed Marcueto, PMSA National President, and L'Oreal Anakino, PMSA UERM President. Okay. And then the Philippine Medical Students Association would also like to award the certificate of appreciation to Ms. Julie P. Caguiot for her invaluable sharing of expertise in PMSA's Paunang Lunas, an online first aid training, given this 19th day of September 2020 as sponsored by PMSA, PLM, and PMSA UERM. Maraming salamat po ulit sa aming speakers.
Thank you. Thank you. Congrats.
Maraming salamat. Salamat din sa panahon. Pagkakataon.
Yeah. Again, we would like to extend our thanks to our speakers, Doc Julie Caguiot and Mr. Jigs Clamor, and of course to our PMSA UERM President Lala Aquino. So yun, no? All things must come to an end. Thank you so much for attending the program. But before that, mag-photo ops muna tayo. So open tayo ng camera. Ayan, open cam. Ayan. Okay, naka-open cam na ba lahat? Sino mag-take ng photo? Anyone from program